All right. Good evening. Today is May 26th, and the time is 5:01. And as a quorum of the committee is in attendance, in this for the executive committee meeting of the Central Health Board of Managers, I would like to call to order the meeting. The first item of business on our agenda is to approve the minutes of the Central Health Board of Managers Executive Committee meeting from April 28th, 2021.
Madam Chair?
Yes, Manager Bell.
I move to accept the minutes of, to approve the minutes of the Central Health Board of Managers Executive Committee meeting April 28th, 2021.
Thank you, Manager Bell. And I see a second by Manager Valle. Thank you. All in favor? Aye.
Aye.
Oh, and Manager Zuniga has joined us. Yes. Opposed? Same sign. Any abstaining? Thank you. Members, the motion passes. Number 2 on our agenda is review and take appropriate action on the prioritization and tentative scheduling of items for consideration at future Central Health Board and committee meetings. And at this time, I will turn over to Perla Cavazos and Brianna Yanes, who will be presenting on this item.
Good afternoon, managers. What you see here is we've switched to a new format for agendas, and now we're kind of working them by quarters. So you have here April, May, and June. We're going to be focused on the month of June. Looking at the tentative schedule for the month of June, I'm going to begin with the regular board meeting on June 30th. What we have so far on the agenda, and we broke it up into financial items, strategic objectives, reporting, and other items. We have the May financials, including operational updates from Community Care and Sendero, which will be provided in the board packet. We will also be presenting, staff will be presenting the draft fiscal year 22 budget. Specifically, the focus will be on healthcare delivery program details. Additionally, they will present budget and financial indicators. Also on the agenda is a DSRIP update. Next, moving into strategic objectives reporting, there will be a presentation from the strategy team on systems strategy and health equity update. And this is following up to the presentation from Episcopal Health Foundation and the grant opportunity and the consultant that will be hired to go along with that grant. After that, we have tentatively listed an enterprise COVID response item, and this is one item we want to discuss with the executive committee. But let me just move through the last item we have so far on the agenda, and we will be receiving an update from the UT Dell Medical School. So I want to begin by asking you specifically on the enterprise COVID response. Right now, we had talked about, usually we provide a COVID update by email, and periodically here in the last few months, we've been providing updates in the board packet from Community Care, Central Health, Sendero. What was requested by Manager Valle, I believe, is a presentation on COVID response. So we put it here in June. I want to ask if it's fine to leave it here, or is there a will to move it to August? So we're happy to take feedback. And Mike, I don't know if you want to add anything to that.
Mike, do you want to add anything?
Yes, thank you for recognizing me. Appreciate it. So in light of what's happening with the pandemic and how we're focused on vaccine equity and then boosters, but then also looking to see what happens. You know, you've read various news reports and heard from various reliable sources that there's still more to come, but perhaps in different ways and on different scale. And so really thinking about as COVID and Corona virus becomes part of the healthcare landscape, that we operate in, what level of reporting are you looking for? What are the reporting elements? Obviously, vaccines and vaccine equity and distribution, especially in high-risk zip codes, is one that I would recommend, but there may be other things that the board wants to hear about. So any guidance on that? And it's iterative, Madam Chair. Obviously, it doesn't have to be set in stone today,
Right.
but just we can adjust it as we go along, but just
Right.
some appreciated.
So thank you, because this really is a follow-on to some of the things that we discussed earlier today. But you know, COVID-19, I think, is a part, as you said, of our healthcare landscape. It's a part of healthcare, just as we have other situations and diseases that have become part of healthcare. We have also, you know, I know that we in particular pay specific attention, for instance, to vaccinations for flu and pneumonia for our underserved and under-resourced patients that we're serving, and are we getting equity in those vaccines even before COVID, right? And so I think, yes, the strategy of vaccines and vaccine equity and boosters is very important. And you know, if there are changes, we'll have to be flexible, right? What we're hearing and reading is that, yes, it could be with us, but be with us in a different level and form. But yes, we'll have to continue to be, you know, flexible and nimble if there is some change with that. So I think, members, what I would like to know is your sentiment. First of all, do we want this on June or in August? And then next, in the future, I'm sure we will continue to get updates just as we do in other areas. But is this something that we just have reporting on periodically, either at Strategic Planning Committee or at the board? I'd like to open it up to hear your views. Anyone? Any views on this and how we schedule this and what's appropriate?
Manager Jones and Manager Valle that are raising their hand.
Manager Jones, thank you.
Well, I guess my question, I think we should be having updates because the pandemic's still ongoing. The question is frequency. I would think that probably at least until September, it should be monthly. And then after September, you might want to consider quarterly or at least every other month. My question, though, in terms of reporting out, what are we going to be reporting out? So we're going to talk about the numbers. And if we're going to reporting the numbers, where will we be getting these numbers from?
And if I can ask a more fundamental question, okay? I understand what you're saying about through August monthly, and I assume you mean we would keep getting the emails, but do we think that we want an update on an agenda in June or in August? Do you have a preference for that?
Well, I'm just coming back, so I would probably say June, but I don't know what the other board members.
What other members? Okay, fair enough, fair enough. And then moving forward, if we had, and we can certainly get into the specifics and get feedback from staff as to what will be in those. I don't know that we'll be able to get that right now, but I think that that is a very good question to pose, and we can get feedback from them. But if we move to, you know, every other month or quarterly, is this something that we should have at Strategic Planning Committee or at the board meeting?
Well, my suggestion would be that the board meeting doesn't have to be, I mean, after we get through September, I would think quarterly at the board meetings, at least for the next year,
Okay.
just a brief update.
All right, thank you.
Okay, but just one other point that I don't know if you answered or not, maybe I didn't hear it, but I want us to acknowledge where's the data that we're going to be reporting on coming from. I think that's important.
Absolutely, I agree. Yes, I meant to acknowledge that. Absolutely. Excellent point to acknowledge where the data is coming from.
Madam Chair, I think just as an initial response to Manager Jones's question, obviously we'll have data from community care. We are starting to collect data from the other FQHCs in response to our work with our equity incentive payments program that we've established. and also Austin Public Health. Now, there are other community coalitions that have dashboards or data sets. I'm not sure about the source of those data, but I certainly think that's informative that we could also bring in as well. And so it's a combination of both internal as well as outside data sources.
And thanks very much, Mr. Giesland. I appreciate that. I think the challenge we're having is we're going to be getting a lot of data that doesn't give us a community-wide perspective. So as long as it demonstrates that this is what it looks like community-wide, and within the community, we have these subsets of providers who are providing their information, we hopefully may be able to ascertain a picture of where there may be deficits we need to address.
Yes, sir.
So that's the goal, I would think, but we need to get the community-wide perspective, and I would imagine that would come from Austin Public Health.
Yes, sir, you would. And there's also some additional modeling and tracking that the med school is doing that takes high-risk zip codes, which is where our focus is, and overlays that with the social vulnerability index, and also looking at mortality and hospitalization rates to be able to, and again, and to your point, not just looking at the average for the county, but really distilling it down to those vulnerable and at-risk areas to look at the equity and the distribution of the vaccine and what the effect is of the pandemic today. But there are multiple data sources that we can pull from. I should say multiple. There are a few data sources that we can pull from that that Austin Public Health is also utilizing as well for its strategies.
Okay, thanks very much. I appreciate that.
Yes,
Thank
sir.
you.
Thank you.
Thank you for the question, and thank you, Mike, for that response. It is very important that we have the entire perspective, but that we get the specific information to the extent that we can from multiple sources wherever we can go. Some of it's disjointed on the people who we are serving, our particular patients and clients. Thank you. Manager Valdez, you had a comment? Question?
Thank you. You pretty much covered it. Thank you, Manager Jones, and thank you, Sherry, and thank you, Mike. Yeah, I'm in agreement. I think that we need to have monthly conversations about this until we pretty much get it set up, and then we can have updated maybe quarterly. And I personally would like to see it coming through strategic planning. And you know, one of the reasons that I wanted this on the agenda is because we need to really be looking at herd immunity. That's why we need to have community-wide information, but we also need to look specifically at those most at-risk zip codes.
Right.
Now there may be data coming in.
Helping with.
Yes, there may be data coming in that's not necessarily, doesn't necessarily contain all the zip codes, depending on how it was collected at the registration site once you get vaccinated. But I think that for purposes of achieving herd immunity, which is what we need to achieve in Travis County, I think it's important that we get that. And if there are any, if there are any trends that we need to look at for tweaking strategies to go into those neighborhoods and make sure that they have access to the vaccinations, then would like for us to do that. And I appreciate you all for putting this on the agenda, and I appreciate the board's support of Central Health and Mike and Sherry and y'all in doing this. Thank you.
Absolutely, very important, and we need to be, you know, keep as informed as we can and as transparent as possible, and with the best information to our ability that you know that we have access to. Thank you.
Just one clarification, because I haven't yet spoken with. We haven't yet had our meeting that we're going to have on Friday, I believe. But with respect to the numbers and what that data set is going to mean, or where it's going to come from, I'm appreciative of any efforts that the University of Texas can do. And I'd like for a clarification as to whether or not Austin Public Health numbers are actually Travis County wide, or if they are Travis County wide, then I'm greatly, we need to have that information also. Thank you.
Thank you. Well, Mike, can you look into that for us, please?
Yes, ma'am. I know that APH goes beyond just looking at the county, and they look at zip code level data as well.
Right.
Good.
And I know that they're on those meetings with Del Med and where Del Med is presenting. So, okay. Thank you. All right.
Chair?
Yes.
You have two individuals.
Thank
You have
you.
Manager Musaitif and Manager Zuniga. Sorry.
Okay. We'll take Manager Zuniga and then Manager Musaitif. Manager Zuniga.
Hi, we're definitely gearing down at UT, so I'm not sure that we're going to have stuff to report every single month since the big
Right.
push is kind of over. So I know we want them every month, but there may be just not a lot of changes month to month. And that, and even though I know we want kind of like they're already we can trust community health care and central health to be doing targeted outreach, so there's not going to be as much change as there has been in the past. So month to month may not be necessary, just with the the bulk of people have now been immunized, and especially those who are in the high risk categories. Our numbers are so high in Travis County that there just may not be a lot to report every month.
Yes, and I think understood, and as Manager Jones stated, once we get into September and beyond, then we may be looking at different, quarterly reporting scenario and some different scenarios. But thank you for.
And one last thing, just to blow our own horn, the School of Nursing has been doing an amazing outreach program with a specific targeted Black and Latino communities, and just want to make sure that they get heard also, as well as the medical school.
You are correct. An important shout out to them. Absolutely. It has been an amazing effort. And, also, I think that there's a lot of trust that's been built up, with various communities with the School of Nursing over the years. So it's so wonderful to see that, and to see that continuing with the School of Nursing, really, nurses being out there on the front line from the School of Nursing. Absolutely. Let's see, Manager Musaitif, did you have something?
Yes, really briefly. I concur with what Manager Zuniga stated and Manager Jones. I think in terms of the frequency, also I want to caution us, it's really easy to collect data, but we have to understand what is the purpose of the data. How can we make this data meaningful? We just don't want to add busy work for our staff that is really not meaningful. And going in terms of staff, herd immunity, we serve a subpopulation. In order for us to have, and we're more general, we need to have all everyone's information, and I don't think that's within our realm, and that's more Austin Public Health than Central Health. But I just want to caution you in terms of the data and the frequency and the purpose of that data collected.
Absolutely, and it's always important too, for instance, if you're asking for an outcome measure and you can't get the data or can't get reliable data, then there's no sense asking for it. So important point. Anything else, managers? I'm trying to scan because I know that there are a couple of other particular items that staff wanted to bring to our attention on scheduling. Not seeing anybody. Carola, you had a couple of other items you wanted to bring to our attention, or Mike, or
Right. Mike had a couple of other items he wanted to bring up.
Mike.
Yes, just briefly, I'll cover two items, one related to policies and procedures and the other related to contract reporting. I see that our compliance officer, Mackenzie Fraser, and Vice President of Compliance is Mackenzie Fraser is on the line, but we need in August, and I'm jumping ahead a little bit, but just for awareness, need to have a discussion with the board about the policy on policies, and that is how things are maintained and how those policies are kept updated. But Mackenzie, would you like to provide an overview on that, please?
Mackenzie may be on mute.
Hello, are you able to hear me?
Yes, we can. Thank you, Mackenzie.
Hey, great. Hello, Board of Managers, and thank you, Mike. Yes, so for the August meeting, I plan to review the Central Health Policy on Policy. And what this is how we as Central Health as an entity oversee policies on PNPs, to include what constitutes a PNP, and to the frequency of how frequently we review our policies and procedures. So it's pretty much the oversight of, as an entity, how we oversee our policies as a whole.
Thank you, Mackenzie. This is very, very important work. And I know we've discussed it previously. And in fact, Manager Valadez, I think, had brought it up when we had our bylaws committee at one point, if my memory serves me correctly, which it may not, but it is very important. And I'm happy to see this coming to the board in August.
Thank you. More to come.
Thank you. So the next item that I needed to bring up for the executive committee's awareness, that is an agenda item, in terms of what we bring back to the board and when, is on contract reporting, and Jeff and Lisa are on the line to provide some more details, but I'll start with the overview. We have some sample reports, and I'll start to share screen. Actually, Brianna, if you could allow me to share screen. Okay, so I just want to get a check on the visual. I know it's a little bit grainy, but do you see a slide that's titled Sample 1?
Yes.
Okay, thank you. So we have contract reports that, and this was pursuant to a request that Manager Valdez had first brought up, and we talked about at the committee, and the thought being, let's come back and have a discussion around what that would look like, not only from the standpoint of the format of the report, but what level of detail and work does the board want to get involved in. Typically, contract management and day-to-day oversight is a management and a staff function, but from a fiduciary standpoint and from an edification standpoint, I mean, I could tick off the categories of reasons why a board obviously would want to have more robust reporting on contracts. That's really a decision that you all need to make. And so, and again, like the prior discussion, it can be iterative. You don't have to decide this tonight, but just to get started in thinking about, what level of involvement and review and analysis is anticipated at the board level with these reports, because that'll help us make sure that we're being responsive in the reporting format. Second is, just to distinguish the difference, and Lisa can probably go into a lot more detail on this, but the way I get my head wrapped around this is that there are contracts or agreements that we have where payments are owed for deliverables, and then there are vendor agreements that, for example, for purchasing. And those are two distinct different types of transactions, but nonetheless, it's to me, one is no less or more important than the other. They're both important because it shows how we're spending money. So with that very basic high-level understanding, this first sample right here is a professional services and consulting contracts, and it's active as of the date of this report. And it shows you the dollars spent on a periodic basis. And so, for example, let's just go to where there's a first dollar amount. You have Collette Holt and Associates. That's the firm that is conducting our disparity study for our historically underutilized businesses program. And you can see, if you follow all the way through, what the contract start date is, and then the amount paid this fiscal year to date. So this would be as of April, I believe. Correct me if I'm wrong, Lisa. And that amount being $24,525. So just to orient you towards what that level of detail is. The next sample, sample 2, is vendor payments. And again, this goes back to the difference between, the contracts that you have and then all the vendors that you work with. But these could be periodically by quarter with the fiscal year to date summary that you can see over in the far right-hand column under E. So with that, I'll stop sharing screen, but just to get some type of, feedback from the board in terms of what you all are looking for, and again, what level of involvement you want to have. That in and of itself would be the agenda item that we need to bring back. I forgot to mention that the conflict of interest reports that Brianna sends out before each meeting have now had some additional information dropped in there, including the contract start date and the not to exceed amounts of those contracts, so you can get a sense about what the dollar is. but to remind the board, and Mackenzie and David, please, again, chime in on this. There is, regardless of the dollar amount of any contracts that are listed in that conflict of interest report, you still need to think about it as, do I have a conflict of interest here, regardless of the dollar amount? So with that, I'll stop presenting and ask the board for feedback on this, or the committee on feedback for this.
Members, any feedback? Not. Manager Valdez, did you have something?
Nothing. Very, very little. Briefly. One of the reasons that I had wanted to see this is so that we could get some sense as to whether or not all our contracts are up to date, whether they're in compliance, have they had any overruns.
Okay. Thank you. I think Manager Valdez may have to. Oh, you're back. You're back. Okay.
Depending on the type of contract or service provided. Also, whether or not there were any duplications with any of the other agencies, taxing or governmental or other agencies, for just for us to be able to have that information. And
yes, ma'am.
Also, yes. And did you want to say something right now, Mike?
No, I'm just kind of getting in line by raising my hand, but I'll come back and address that last point.
Okay.
And then also whether or not they have been current in the provision of all the requested information from Central Health. I want to make sure that they're making sure that their paperwork is up to date and that they're in compliance. And that's all. That, it's basically making sure that we're doing okay with our contracts.
Thank
our
you.
Contractors are being true to Central Health.
Right.
And our mission. Thank you.
Thank you, Manager Valdez. Mike, did you have something you wanted to comment?
Yes, I can answer the dual funding source. If I were to take the overrun issue and the compliance issue, I'll have to think out loud on that one for a minute. But coming back to the funding issue, our systems will not know, if you will, if other entities are also funding some of the very people that we're contracting with, whether they have a separate contract for goods or services, or if, for example, we have contracts with providers, and I've got a sample that I can show you on the healthcare delivery side, what that looks like as well. So if we have a contract for ear, nose, and throat services with Austin Regional Clinic, our system is not going to know what other contracts other entities might have with Austin Regional Clinic. Now, where we get to that is, for example, if we're going to enter into an agreement or an arrangement and we do due diligence and we ask questions, and like this is what we did recently with HAM, is knowing, what other funding sources do you have for this? We've done something similar with Integral Care before on a funding arrangement that goes back a couple of years. So that's where we would know that, and that's something that we would just need to bring up with the board each time that we bring something to you all for approval, is to note, hey, here's the other funding sources in this. But I don't think that's not a capturable element in our systems that we use for contract lifecycle management, but also on our accounting side as well. So that's the first consideration. The second consideration is in looking at the overall compliance, whether or not there's overruns, whether or not the documents are up to date, deliverables, et cetera. So anything that just falls into the general category of compliance. This is something that each contract owner within Central Health has responsibility for. And again, when there are issues related to contract compliance, they get escalated as needed. But I think this is the sort of thing that, and again, I'm thinking off the top of my head, and so I'd ask Lisa or Jeff to chime in on this, that you would have to build out a system that, if we were to present this to the board in this type of reporting format, that shows whether or not it's in compliance, out of compliance, what the reason is. And that's something that right now is the responsibility, again, of each contract owner. And then we would have to aggregate all of that and report it to the board. Now, what I would need to think through and ask the board to do the same is, if, let's just say we have a quarterly reporting frequency, and that's another issue that needs to be decided, is frequency. Obviously, we could highlight, and we may need to do this in the presence of legal counsel, because there might be legal issues, contracts maybe that are non-performing, so that the board can have line of sight into that, whether it's by deliverable, or maybe there's a contractual obligation, maybe they were required to provide us notice for something and they didn't provide us notice on time. But if you've got a contract that's in breach, then that's something that we would have to visit with the board about. Now, again, all of this is done at the management level. And so what the board needs to think about is the amount of time that you would need to invest in order to be able to do this properly. So I'll pause there.
And I think, if I may, I think that's a very important point, and that is that, you know, there's no way that we can have access for the people, some of these people who we're contracting with, to everyone else who they contract with. It's not information that's available to us in any way. As Mr. Giesland said, you know, we can ask if we do an RFP or something like that, and I would have to defer to David Duncan to what's, you know, allowable. But I think that he does raise an important question, and that is with the staff we have, who we're very appreciative of, and the workload they have, you know, what would we want to do, and what would we be asking them, and what is feasible? So those are important questions. Manager Valdez, did you have something you wanted to say?
Yes. You know, I used to be able to sit in on the audit committee in their report to the city council. And I would listen to their auditor talk about all the contracts that the city of Austin had that were in breach. Organizations not submitting paperwork for years, and they kept getting funded, and they kept getting funded, and nobody at the city even slapped their hand for non-compliance. And maybe we don't have that many contracts, and so maybe that's a reason that we don't have an audit component within our agency. But it appears to me that should be, at least further down the line, as we're getting more and more people coming to us for funding, since the other governmental entities are limited to the 3.5% tax. So Manager
Yes,
Valle,
ma'am.
they are coming. But I want to make sure that whoever we enter into contract with, is it something as simple, David, as asking the question, are you funded from where? Who do you receive funding from? Because my understanding that we did.
I want to see if we can separate these, because we're really talking about two different things. Okay. So let's see if we can separate them, because from what I've heard, there are two different issues. One is, do we have the data, or do we have access to, with people we contract with, all the other contracts that they have? And no, we don't. So that's one issue. Okay. And what could we, you know, and there are things that we can ask of them, as Mr. Giesland said. A separate issue is the compliance, which is extremely important. Having a system to know, you know, when you enter into a contract, we at Central Health are holding the public's funds in trust, right?
Right.
And when we enter into a contract, we are, of course, still responsible, and we do need to ensure that those we contract with are living up to all of the conditions of the contract. So we have two separate issues here. But certainly, I do agree that it is important that we have a way of knowing if those we contract with are living up to their obligations, and of flagging and bringing to attention those who are not.
Madam Chair, if I may, because I was answering a portion of Manager Valdez's question just with top of mind awareness, and not, full disclosure, not the subject matter expert in this, but I would ask that if there are some other team members on the line that would like to provide some commentary that you think is responsive to the question on the table.
Certainly.
Lisa,
I would like to speak.
David,
Manager Valadez had a couple of specific points I could speak to. Manager Valadez, you asked that question, can we ask partners, especially people that we're providing some kind of funding to, not in the typical, contractor, we're going to pay them, they're going to provide us widgets, but more in the funding vein. Can we ask them where else they get funding? Well, there's two opportunities to do that. One is you ask them before you give them money, or two, you make it part of the contract. That's the only way you're going to get that.
Right.
You make it a reporting element. So some of these entities, in fact, a lot of them are probably nonprofits. They're probably not governmental entities. If they're governmental entities, we can ask and we can get whatever paperwork they have on funding.
right.
But nonprofits, it's going to be a little bit harder.
And did we have, I thought I heard somebody else in staff who was getting ready to respond. Did I hear someone else?
I guess I'm happy to just chime in. I don't know.
Please
I
do.
think what I'd like to do is kind of go back with Mike and Mackenzie and talk about what we can do. But I would just say you're right, Manager Valadez, we do not have an internal audit department like some of the larger government organizations. So I think maybe what you were mentioning may exist at other entities, but at our size, that is not, it is part of our role, and it is part of what we do every day. And so I just, I'm happy to go back with Mackenzie and David and Mike and kind of talk about next steps.
I think that is an excellent idea. We certainly do not expect answers to these very complex systems and issues and complicated issues. So I would, if it's okay with the members, recommend that in fact that be exactly how we proceed. Manager Musaitif, did you have?
Mine is really brief. I think with these organizations, there should be a level of trust, and also some organizations who may have different specific aims they want to address in their study, that they're allocating funds for this specific aim or whatever they have. So overall, and also many of these organizations have to report back to stakeholders. And I'm sure if there's duplication of funding, you're going to know about it. So again, just a matter of caution. And I think we need to have a level of trust, whoever we're providing. And I think the staff have done a phenomenal job with vetting these RFPs.
Certainly, staff does a phenomenal job. There's something, trust and verify, right? So certainly, we want to respect people. And if they're public entities, we have publicly available information. If they're nonprofits, there may be some in annual reports, but or if they're getting grants, then it would be, outcome measures to those who are funding them. But I do think it's important to trust and to verify. So thank you, Manager Musaitif. Manager Valdez, did you have anything?
Yes, the trust component was never a consideration.
Right.
What was considered by me for the purposes of suggesting this is just being fiscally responsible. We're just not going to be used to writing checks. We should be making sure that those monies are spent the way they're spent. I don't believe we've ever had a problem in the past, but there are different kinds of contracts, with respect to construction, in the construction business, sometimes there are other reasons why someone can't necessarily comply with a specific timeline, and it's out of their control, but we know those things. I just want to make sure that we are being fiscally responsible as a board, that we are complying with our fiduciary responsibilities as we're required to do by law,
Right.
and that we take that tact with respect for protecting our taxpayers' dollars. Thank you.
Absolutely. As I stated,
So-
we have a fiduciary responsibility. We hold those funds in trust, actually, the public dollars. And so
Right.
we do need to ensure that there is the proper accountability. Thank you. Mike?
So yes, I think if I could sum up maybe what I think I hear as guidance from the committee. You've seen some sample reports. We can continue to bring those back on the frequencies noted. We'll continue to do the conflict of interest reports that provides a little bit more information. with each meeting. And then it sounds like, though, that what I would recommend is that you allow, per Lisa's recommendation, for myself, Lisa, Mackenzie, and David, potentially others, to huddle to figure out, okay, what we're currently doing at the management level, how do we bring that to the board on the compliance side?
I
Maybe
understand.
starting
Yes.
with those that are at risk or those that we're having issues and we need to let the board know about it. But then I think where we're headed is actually in line with where we're progressing as an agency, because obviously we're building and improving upon our compliance programs. We've got new contract management, not only software, but systems and processes that have been implemented this fiscal year. Looking forward to future changes on our financial and our accounting systems. And as we mature and become more sophisticated, have more sophisticated operating environments, these are the sorts of things that we will address regardless. So I think the timing is good, but to Lisa's point, we need to flesh out the compliance piece for you all a little bit more.
I concur, and please, whoever, of course, on staff is needed to in your huddle. That's the decision of those who are have the knowledge and expertise in staff. And I do know that our staff who are in our fiscal positions are of the highest quality. We have achieved awards lately. And I do know that given our size, this is really part of their day-to-day operations as opposed to an entity that's the size of the city of Austin. I am certainly appreciative of all that they're doing day to day. All right, is there anything else on this item?
Ma'am, Chair Greenberg, I just want to close by thanking you and all of you for your time. I want to remind you that we still have we have several meetings in June in addition to the regular Board of Managers meeting. We are planning to have a regular strategic planning meeting on June 9th where we'll have. I can't help you, but I can't. We'll have part 3 of the board retreat also on June 9th. We have a special called meeting planned for Monday, June 14th, in addition to a budget and finance meeting immediately after that special called meeting. And we'll do our best to keep them as short as possible. And we're doing this so we can take the month of July to not have any Board of Manager meetings.
Thank you. Thank you very much. I appreciate the updates and appreciate the discussion from the managers and the staff. Very, very helpful. And with that, I will move to agenda item number 3, which is to confirm the next regular executive committee meeting date, time, and location. Managers, our next regularly scheduled Central Health Executive Committee meeting is tentatively scheduled for Wednesday, June 30th, 2021 at 5 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment. Manager Valadez is moving adjournment.
Yeah, and I second it.
And Manager Bell is seconding it. Oh, you're trying to trip me up now, aren't you? So we have a motion and a second. All in favor, aye. Aye. Opposed, same sign. No in opposition. All right, we are adjourned. Do we stay on here for our meeting, right? We no longer have to go to a separate link. So just stay right here, folks. We're trying to be as efficient as possible. So now, good evening. Today is May 26, 2021, and the time is 5:45. As a quorum of the board is in attendance, I would like to call to order the meeting of the Central Health Board of Managers. The first item of business is public communication. Yvonne, do we have any public communication this evening?
Yes, Madam Chair, we have 2 speakers this evening. So if I may, I will read the guidelines for public communication.
Yes, please.
Thank you. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail message by 90 minutes prior to the start of the meeting, including individuals are asked their preferred language as they register to speak, and both the online form and voicemail greeting are in English and in Spanish. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. And at this time, I will call on our first speaker. And his name is Jameson. I'm sorry.
Yeah, Tiemann.
Thank you.
Cool, thanks, Ivan.
And he is with the Dell Medical School. Jameson Tiemann?
Yes, perfect, nailed it.
Here you are. Okay, and I will start the timer now. Thank you.
Howdy, y'all. Can I firstly get a thumbs up if y'all can hear me? Perfect, awesome, thank you. Firstly, thanks so much for having me on the call. Like Ivan said, I am, as of 6 days ago, Dr. Jameson Tiemann. I'm a dual MD. Thank you very much. Thank you very much. I'm a dual MD, MBA graduate of Dell Med and Macomb School of Business at UT Austin. And I'm really excited and honored to have the chance to briefly speak with y'all today. I actually had the chance to work on an executive, nonprofit executive board for the last year through the MBA. So it's really exciting to kind of see how y'all do business as well. It's really, really great work that y'all are doing. I will be respectful of your time, but I kind of just wanted to hop on the call and share my journey and my perspective on why what y'all and your partners do is really meaningful to me. So as a brief introduction, I'm from Austin. I was raised in the city, did all of my education here, and after finishing up my undergrad at UT, I was actually the assistant supervisor of operations at Austin Travis County Integral Care, which as Mr. Giesland alluded to, it sounds like y'all are probably aware of it, but if you're unfamiliar, it's very similar in some ways to Central Health insofar as that it serves some of the most underserved members of the Central Texas and Austin community. And it was there that I was exposed to y'all, to the medical access program in particular, which then has now allowed many of our underserved patients to receive necessary care. And it was really there that I developed my passion for medicine, but specifically for community medicine and for treating vulnerable populations in the community. So I'd really like to once again take the opportunity to thank y'all for occupying a really, really essential role in the community, and really on a personal level for informing what would eventually become my career. So thank you. And speaking of which, I will be pursuing emergency medicine at Miami, Florida, at the University of Miami, and their county hospital. And I really wouldn't be here if not for Central Health or the community partners, Sendero, obviously, MAP, as I already mentioned, but I really just wanted to shout out community care in particular, because it was there that over the last 4 years, I spent hundreds of clinical hours learning how to be a doctor and sort of developing and reaffirming my desire to serve the community. And of course, my appreciation for Dell Med goes without saying. And it's really rewarding to hear about the strong partnerships that y'all seem to have and maintain with UT schools of medicine and nursing. So in any case, again, I'll be respectful of your time. But again, thank you for the chance to speak with y'all today. Look forward to practicing in Austin in the future. Look forward to working with y'all in any way that I can. And if y'all have any questions for me now or at any other time, I'll be available. So thank you, and I'll let you get back to the meeting.
No, thanks to you. Thank you for your service. Thank you for your commitment to our community, and thank you for taking the time to come to our meeting today.
Sure.
And we're really proud of you.
Thank you, Manager Greenberg. I appreciate that.
Thank you.
Thank you, Dr. Tiemann, and once again, thanks for joining us as well. Our next speaker and next and last speaker for this evening during public communication is Mr. Jeff Knodel. He is our Vice President and Chief Finance Officer at Central Health. Jeff?
Yeah, thank you, Board. I'm here tonight, myself and on behalf of a number of people, here to recognize Sarah Cook, who is the Senior Director of Strategy and Planning, who will be leaving Central Health after 10 years of dedication to pursue an exciting opportunity to lead a family services agency in Western Massachusetts. Your colleagues have some parting words, Sarah, and we're sharing those on the screen via the Kudo board that you see. Sarah joined Central Health in June of 2011 as the Director of Business Development and quickly went on to lead our region's participation in the 1115 waiver. She built the Deseret team from scratch, hiring many of the people who make Central Health what it is today, to serve as a high-functioning, creative, and fast-paced team working to create meaningful changes in the healthcare system. Her leadership made the performance of the Deseret projects in the 1115 waiver so successful and was a result of all of the hard work and dedication to the mission of Central Health. Sarah was instrumental in transforming the healthcare delivery system in Central Texas, and I can say that she truly cares most about the vulnerable persons in Travis County and was able throughout her career at Central Health to reimagine healthcare based on their needs. Sarah may be leaving Central Health, but the models of care that she envisioned and helped develop will continue to provide patients with access to quality healthcare and improve outcomes for years to come. And I think just thinking back on a few of the earlier projects that were developed and that were so successful, and these were projects that weren't projects just to ring a bell to get paid. They were projects to be meaningful to the community. Was, you know, a couple of major examples were there were a lot of Travis County residents that were cured of hepatitis C, and that was just a on the edge, cutting edge type project that just had such benefits for the community. Another area was the development. You know, we take telehealth for granted now, but you know, back 10 years ago, we had a Deseret project that incorporated telehealth, and it set a lot of the platform that we utilize today and really helped position us for care to be able to provide more access to care for the patients who need it the most. We're extremely thankful for Sarah's contributions and wish her continued success and happiness on her next adventure. Thank you, Sarah, for all your dedication to Central Health, and best of luck. And we're looking forward to hearing more about your future adventures. Thank you.
Hear, hear, and kudos. You know, I have had the opportunity to work directly with Sarah. I know many of us have. Her wisdom, her intellect, her creativity, her compassion will be greatly missed. This is bittersweet, but so happy for this outstanding opportunity for you, Sarah. And if we were in person, we would be able to present perhaps flowers and chocolates. So thinking flowers and chocolates. Thank you, Sarah. All right. With that, do I see, just waving? Okay. With that then, we will move on.
I think Manager Valadez has something.
Okay, I was trying to tell if people were waving or had hands up. There's some tiling tonight. Manager Valadez, yes.
I want to thank you, Sarah, for all the work that you've done, and especially for Deseret and for Central Health, for our patients, more than anything, okay? You have helped put us on the map, and I really appreciate that. We're going to continue to have meetings like this, and I wish we could do little emojis that send out hugs. Okay, where's our IT guy? Mike, where are you? Okay, that's what we need. Thank you. Bye. Good luck, and I'm jealous of you going to Massachusetts.
Did anybody else? Okay, Manager Musaitis, yes.
Well, Sarah, thank you so much for everything that you have done for our community and for Central Health. You will be missed immensely. Thank you for your friendship, for your wisdom, for your patience and persistence in getting things done. We really appreciate you and will be dearly missed. Thank you for everything.
Thank you. Anyone else? If I miss you, shout out. If I think you're waving, but your hand is up. If I think you're waving goodbye, but you're trying to speak. Okay, well, I'm not seeing anyone else. So Yvonne, do we have anyone else for public communication?
No, Madam Chair, that concludes our public communication for this evening.
All right, thank you very much. With that, then, we will move on to the consent agenda. Item C1, approve the minutes of the Central Health Board of Managers, April 28th, 2021 regular meeting, March 23rd, 2021 board retreat, and March 23rd and April 16th, 2021 special called meetings. And item C2, receive and ratify Central Health investments for April 2021. Is there a motion?
Madam Chair, I move that the board approve consent agenda items C1 and C2.
I see a motion. I see a second. A motion by Manager Bell, a second by Manager Valadez. Any discussion? Seeing nor hearing any. All in favor, aye.
Aye.
Aye. Opposed, same sign. Any abstaining? One abstaining, Manager Jones. Thank you, members, that the motion passes, and we will move on to our regular agenda. Item number 1, receive an update from Integral Care on Central Health's financial investment and how it has contributed to fiscal year 2021 outcomes supporting Central Health's mission, serving indigent residents of Travis County, and Integral Care's future opportunities and challenges. And we are delighted to have with us here David Evans and Ellen Richards from Integral Care, who will be presenting. So I will turn it over to them.
Thank you very much. We very much appreciate being invited this evening to do a brief update on the operations and work at Integral Care. There's going to be a couple of things we'll mention that for some of you may be repetitive. However, just for a level set, we want to mention that Integral Care is a governmental organization sponsored by Central Health, the City of Austin, and Travis County. In appointing 3 board members each, I also want to compliment that your current appointees are Dr. Zamora, who chairs our Planning and Operations Committee, Trish Young-Brown, who chairs our Finance Committee, and Hal Katz, who is the chairman of the board. So it's a very strong team that you've linked into the policy oversight of our operations. Thank you. I want to also mention that we have a focus, both contractually and in the law in the state of Texas, to work with individuals who have and present with diagnosable mental illnesses, substance use disorders, and intellectual and developmental disabilities. And then also, there are some very complex cases that may have trimorbid conditions, and we've seen at times up to 70% of folks presenting in crisis who have co-occurring mental illnesses and substance use disorders. There are 39 local mental health authorities that cover the 254 counties in Texas. And I want to mention we really have 2 roles. The first role is to serve as a provider in terms of direct treatment and care for individuals. And second of all, a governmental responsibility as a local authority. Big word, but in our contractual relationships with the state, we need to submit an annual plan to be approved, a quality plan, and then a network plan where we manage contracts with other providers within the county. And sometimes that's a little confusing on both of those roles, but I did want to highlight that for you this evening. And so, as I previously mentioned, we're governed by a board of trustees, 9 individuals, And very interesting, as part of a legislative action last session, the Travis County Sheriff has joined our board as a non-voting member. So for individuals that are engaged with the public safety and criminal justice systems, we really find it very helpful for leadership and direction by the sheriff. Next slide. So Ellen and I are going to work on this together in the way of a joint presentation. Again, very briefly, there's something that may be new to some of you, probably not your staff, but it's a designation by the Health and Human Service Commission to be a certified community behavioral health clinic. This CCBHC in many ways has a parallel connotation nationally as the federally qualified health clinics. And there's a set of collaborative care responsibilities and outcome reporting that we'll need to provide. And there are already designated future Medicaid payments as being part of the CCBHC. Joint Commission, we've been accredited since 2012. And we want to mention also that in terms of our hotline in our call center, that we're accredited to the American Association of Suicidology. And we've held that for some years and work on continuous quality improvement. Next slide. We posted this past week our annual report from 2020 on our website. Please feel free. I'd encourage you to take a look at it. It covers the wide scope. These are just 4 points here. I'm not going to read them to you, but it's regarding numbers of folks served and services provided, and the different types of programs that we would like to work in concert toward this system of care in Travis County. Next. So you've invested in and through us. I listened from the beginning of your last conversations on contracts and deliverables. And so I'm going to turn this now to Ellen Richards, our Chief Strategy Officer, to talk about your funding, investments, and work through Integral Care. Ellen?
Thank you. Next slide. Good evening, Ellen Richards, Chief Strategy Officer with Integral Care. It's an honor to be with you and appreciate the opportunity to share this information with the Board of Managers. Since probably 2006, the Central Health has invested in psychiatric crisis services in our community, including access to inpatient services, and then more recently, access to crisis respite and residential to reduce the need for inpatient hospitalization, and then more recently adding navigation services. As a result of COVID, we did work with your staff to add funding for individuals who are COVID positive and require hospitalization. To date, we have not had to access that funding except for, I think, for about 2 individuals. Next slide. Unlike prior years, I wanted to bring forward some metrics. There's a ton of metrics on this contract for the psychiatric inpatient and crisis respite programs. This is just a handful of the metrics that we track. I do want to let you know that we have an agreement with HHSC to provide inpatient access as well. And whenever possible, we use those dollars first and then use the central health funds. So we're a little bit behind on meeting our targets this year just because there's been a little bit more HHSC funding available. Next slide. So another area that we've worked on together over the last few years is on medication-assisted therapy for individuals experiencing opioid addiction. This is a collaboration with Community Care. Community Care provides access to the medication, and we provide behavioral health supports. And we find that that collaboration makes this program more successful. It is partially funded by other sources, and so I've given you the total numbers because I couldn't break out just the central health piece. I do want to note that you can see the milestones there, and we have a high retention rate until you hit that 8th milestone. And so I double checked with the team, like, what's that about? So nationally, these programs run about 45 to 50% compliance or retention in them. And in Travis County, this number really doesn't reflect who stays in the program. It can be impacted by things like change of insurance or change in provider. Some of these folks may only need a level of care that could be provided with community care solely and not need the behavioral health supports, or they may have changed insurance and not be able to access this program through us. Next slide. So the last area is our collaboration with Sendero Health Plans, and this has been over the last couple of years. We've provided a behavioral health case management per member per month program for their highest, most intense cases. And what I wanted to point out is that we were able to do a small ROI analysis on some of the folks in FY20 that were served. And you can see there that of the complex cases that were referred, we looked at 33 of them and found that per person we saved about $3,800 per month during the 8 months following their first service. So I feel like this is a demonstration as we do more of these ROIs on our programs that we're really able to demonstrate the impact of these programs. Next slide. So I'm going to pass it back to David, and he'll talk about looking ahead at opportunities and challenges.
So Perla's going to be very happy that we're going to be within this 10 minutes. Opportunities, yes, absolutely focusing on racial equity. Our board has had several retreats, has worked with an outside consultant, and has adopted the Governmental Alliance on Race and Equity Toolkit in guidelines. Tomorrow evening, our board will review our plan going forward for achieving a higher level of racial equity. Another opportunity is this intersection of behavioral health and criminal justice. You already probably have heard that working with the city, some things like embedding our staff in the 911 call center and mobile crisis outreach. Next is working with the county ahead, in which they're looking at charges, restoration of competency, and other types of, again, this intersection. We're continuing to work closely with the Dell Medical School. I'm really pleased at the progress we've made. We stood up this year an addiction medicine residency program. That's setting the bar from some additional things that we're going to take on. They've worked with us closely on some of the economics and some of these ROI, return on investments. We're working on the ASH redesign closely with their work in HHSC. And then also we've been able to embed their docs in a number of our services, as opposed to going to locum tenens and other types of less stable relationships. Technology is extremely important. If we went through, we could have another whole chart on how during the pandemic we moved to telehealth and telemedicine. And then we work closely with you all and your leadership with the integrated care collaboration, the health information exchange. Two last things, we're preparing for the July 2022 rollout of the 988 phone number. We're currently working on preparing for automatic rollovers from anyone from our catchment area that dials that number looking for help in crisis and suicide prevention. These are just a few of the opportunities ahead. We want to continue to work on credentialing prescribers in pharmacy and make some progress. And I want to thank Chair Greenberg on setting us on a course for a narrow study we've been able to do in terms of how we can work more closely with the MAP program. Next slide. So in conclusion, we certainly are facing large challenges. I don't want to present this like we're somehow on a simple road. We've got extraordinary continued things in our path ahead. I've heard some of your discussion on COVID lasting impact. We believe, we read, we see in studies, whether it be the Kaiser Family Foundation or current news articles on the impact of stress, loneliness, loss, and what that may mean for both substance use and future trauma and mental health impact. Homelessness and housing. Once again, our board has a board staff task force on defining our role in terms of additional housing. Housing is a health solution and addressing homelessness in the city of Austin. System gaps. I just would mention on these complex individuals to be served. We expect to work closely with Mulva, the medical school, and have some consultation on folks that just have not done well in terms of the course of their psychiatric treatment, but believe that there's hope for improvement in their conditions. The last thing I'll end on is what very recently has become an unclear future on the continuation of the 1115 waiver. As you know, that this fall is going to end. Up until a month ago, we had an uncompensated care pool approved by the federal government, working with HHSC to set up our ability to bill. For us, this is in the nature of $16 million. And the current administration rescinded that UC pool. And in that regard, we're continuing to work with the state on guidance on what we may be able to prepare for in an uncertain future ahead now. So I'll end on that note and turn this back on my part. Ellen, I don't know if you have any concluding comments. We'd like to answer or dialogue on any of your questions this evening, or follow up with staff on things that we can't answer that you may want data on as an example. Thank you.
Thank you. Thank you so much, Mr. Earl Evans and Ms. Richards, for being with us. We appreciate all that you do for our community, for our patients, for those who are experiencing trauma and other situations. And that was a very informative update. I had just a couple of comments or questions. One on the 988 number. I think this is very important. How will this be publicized? I have had over the last year situations where I have advised people perhaps to call a hotline or to seek immediate help. How will you be publicizing the 988?
Well, we're going to do this in concert with some of the statewide rollout and some of the other contracts that we're going to braid into this work. So I don't have a specific answer. Ellen, under your areas of communications, have you been part of any of these preliminary discussions on communicating the rollout?
Not as of yet, but I will say we worked closely with the state on a rollout of a communication about a statewide hotline during COVID. And so even developed the graphics and messaging on that for the state. So we will be, working closely with folks on that. I will say, I hope you know, Manager Greenberg, that there is a 24/7 helpline for people in crisis that they can call anytime, 512-472-HELP, and we're there 24/7 for anybody that needs help.
So I do, and in fact, I have sent people to the hotline specifically at Integral Care. Yes, I have. And that brings up another issue, one that I am curious about. As you know, we have a large number of students and of college students from quite a few universities within our area. And many of these college students are of extremely low income. So of such low income that when we had the storm and outage, they couldn't buy food. They couldn't do many things. It was quite dire. Have you, and this may be anecdotal and you might not have the answer, but have you been seeing any increase in number of students who are coming to you for assistance?
I would say that we would need to check with our teams to see if there's been an uptick in that. I would say for sure basic needs issues have increased considerably during COVID.
Not just basic needs.
Community-wide.
Not just basic needs issues, but actual significant mental health issues.
Yeah, that as well. Yes.
Significant mental health. Okay. Just curious, if you have any data on that, I would be just interested to know. And then on homelessness, of course, that is an issue that we're very cognizant of because so many of those that we have the privilege to serve Many of them are unhoused, and we appreciate the work that you're doing there, and in concert with Host and community care and others. With COVID, as you've heard us discuss, we know that it has meant ongoing trauma and will mean for many as far as mental health and behavioral health and physical health. We also know that it is going to be in some way or another part of our lives and health and mental health system. So appreciate your efforts there. Members, questions, comments? Manager Valadez.
You're on mute, Manager Valadez.
Thank you. I just have a couple of concerns that I want to bring to your attention. We've been part of the MHMR system since Gloria was practically born, and have a great respect for everything that you do for our population. But there, as she has aged and is still alive, and as I have maintained relationships with all of the other parents who have had special needs children with mental and behavioral issues, and then they've grown now into adults, I found that their common concern for those that are non-English speakers is that there's not enough bilingual caseworkers. And they have asked me several times to talk to whomever is meeting with them. So I think internally that's something maybe you all have some better information about, whether or not you have sufficient bilingual case managers, who are there in your system and relatively stable, because I have noticed one of the things that you all do have is a turnover of case managers. I mean, this past year alone, I think Gloria's had 3 case managers from IC, Integral Care. So that's one issue. Second, the adult day habs that Integral Care a lot of times will pay for the participation of your patients into those day habs. Many of them will allow their patients to just sit outside all day long on picnic benches and smoke all day. Some of them are located next to or close to, in close proximity to vape locations, and they will go during the day to the vape locations. Now, I have been, I believe it or not, I used to smoke. And many years when I first found out I was pregnant, that was it. Never touched a cigarette again. But I will tell you that it bothers me greatly that between our patient population being allowed to sit outside all day long and smoke cigarettes, go buy cigarettes, have and then sit with their care providers who are employed day habs, the adults that you are paying the contracts for, bothers me greatly when the care providers themselves are the smokers. Now, we have their mental health, behavioral health issues, and they'll tell me, well, they're better off smoking their cigarettes. And I'm sitting there going, looking at the cost, the medical cost of an additional chronic illness that is going to shorten their lives. And I'd like to know if there's anything that has been done to look at this, or to, or is that something that you all cannot regulate? Do we have to go to the legislature to get legislation to get the state to make sure that that doesn't happen anymore, or that if that is becomes that's a big in our already at-risk population?
Thank you, Manager Valdez.
Just very briefly, thank you so much for bringing that up. And I would like to just comment on it briefly if I could. Our board adopted, I think, a very clear and firm boundary on being a tobacco-free campus. This includes, all of our sites that we operate. Next of all is that we're on a 4th round of the Cancer Prevention Research Institute of Texas funding, in working with the University of Houston and taking Texas tobacco free. And so in that regard, we not only have worked inside of our own services, but we have had rounds of funding with substance use treatment providers, and most recently funds to go into rural areas with FQHCs to promote policies, practices, tobacco cessation, anti-craving medications. And so we're right there with you on the I don't know, it's the single most important thing you can do for your health is to no longer use tobacco products if they're in use. Now, in terms of our contracts and working with our providers and their primary guidelines and oversight from the state, we try to influence, try to provide training, try to provide technical assistance, but we don't regulate their policies and use. And I think that the idea of picnic tables, this is just my editorial comment now because you have me going, is another way of actually promoting tobacco use by creating a channel or a way for easy opportunity. I also respect individuals in the addictive nature, and being part of substance abuse treatment needs to recognize that nicotine has a brain-based impact on individuals. So the compassion in our services isn't any kind of shaming, but to really try to lead through motivational interviewing and other approaches a road that would end the use of tobacco products. So in summary, I see the issue as you have it, and I also try to clarify the boundaries.
Thank you so much. Members, other questions? Okay, not seeing anything.
At some point then, David, I would like to know if there's anything that we can do to help get this addressed as a serious issue. This is we're already talking about a population that's in the Medicaid waiver program, or at least in a Social Security disability program, and y'all are getting dollars, and the home health care agencies are getting dollars, and then the adult day habs are getting dollars, and then the employees who themselves are addicted are getting dollars. And at some point in time, when do we draw the line? Okay, is it a federal line that we have to cross? Is that a state line that we have to cross? But this just food for thought. And since you have at least one board member, Dr. Samwada, who I have a great respect for, on your board, I just wanted you to hear my concerns, because I'm not alone. I have hundreds of parents that I have spoken to that are right there with me. Thank you.
Loud and clear. Thank you.
Thank you. Thank you, Manager Valdez, for
and also the issue with bilingual case managers.
Noted.
Thank you, Manager Valdez, for bringing forth your important concerns, and thank you, Mr. Evans, for your responses, and we look forward to hearing more. Okay, anyone else? If not, thank you for your time that you have given us this evening. We know you're quite busy, so we appreciate it and all that you do for our community. Thank you. Members, we will now move to item number 2 on our agenda: receive a report on fiscal year-to-date healthcare service expenditures made by and accept the preliminary April 2021 financial statements for Central Health and the Community Care Collaborative. Lisa Owens and Patty Bethke will be presenting. Thank you.
Thank you, Manager Greenberg. I'm just going to hand it right over to our controller, Patty Bethke.
Thank you, Patty. Welcome.
Yes, good evening. Thank you. Patty Bethke, Controller. I'll be presenting the financials to you, and I'm just going to hit the highlights on the financial presentation rather than going through all of the detail on the slides. They are included in your board packet, and staff will be available if you have specific questions as you go through. Hopefully you've had the chance to review it, and I'm happy to answer any questions if I can, or take them back and get back to you. So here are the highlights. Next slide, we'll jump right into the balance sheet. On the balance sheet, the assets show we continue to have a strong cash position with our current assets at $369 million. We have total capital assets of $64.8 million. Next slide. Moving on to liabilities and equity, we continue to have relatively low current liabilities at 15 million. I do want to point out other payables of 1.8 million for the tobacco settlement funds that are due to Ascension Seton and to Travis County. And the other deferred revenue, which is now zero as we recognize the last year of the prepaid lease revenues. Our net assets are currently at 536 million, and they've increased 67 million year over year. Moving on to sources and uses. April represents 58% of the fiscal year. Our property taxes are strong, stronger than budget. They're at 101%, but they have slowed from March receipts of 2.5 million to 751,000 for April, which is expected. Central Health's annual tobacco settlement payment is also recognized this month at 3.9 million, which is 138% of the budgeted revenue. We did not have any significant healthcare program or administrative program transactions, and our operations continue to be steady. Turning to our excess sources and uses, we are negative 2.1 million for the month and positive 319 million for the year. Moving on to CCC, the Community Care Collaborative. Okay, here are the highlights for Community Care Collaborative, and we'll move to the balance sheet and balance sheet slide. CCC showing a strong cash position at 8.8 million. Our total liabilities are currently at 7.2 million, mainly due to the disrupt metrics that are payable later in the year after the disrupt funds are received. On the sources and uses, next slide. The total sources for funds for year to date is 12.2 million, and that's flat from the prior month. And the total uses for healthcare delivery and disrupt projects are 15.4 million with no significant changes in the services provided. And that concludes the financial presentation, if anybody has any questions.
Thank you. Members, any questions? I know we had this in the backup, and we appreciate the presentation. Members, if you do have questions later, you can contact Perla or Brianna, and they will put you in touch with the appropriate staff. All right, well, thank you. Thank you very much. Appreciate it. We will now move to item number 3, receive an update and discuss homestead exemptions for the fiscal year 2022 budget cycle, including possible changes to exemption allowances for Travis County residents who are over 65 or disabled veterans. Jeff Canota will be presenting. Jeff, I'll turn it over to you.
Thank you, Chair Greenberg. So tonight we're going to briefly talk about optional local government property tax exemptions. If you could forward to the next slide, please. So these are 3 of the optional homestead exemptions that exist for local governments. The homestead exemption, the over 65, and the disability homestead exemption. This chart shows of those 3, all of the taxing jurisdictions in Travis County and what these optional local exemption amounts are. I'll start with the homestead exemption. The homestead exemption is actually capped or has a maximum amount of 20%. And you see that Travis County and Central Health are at that maximum level. You'll also notice that Central Health has the same amounts as Travis County. We have stayed kind of lockstep with them related to all 3 of the exemption levels over a number of years. And then you see the other taxing jurisdictions, the city And then the school districts have a little bit different dynamics related around some of their exemptions, but just to compare what they are for all of the jurisdictions in Travis County, this is a good place to start looking at the amounts of exemptions available for fiscal year 2020. Next slide. So tonight we're really just teeing this item up. It's informational. We will be back in June to work with the board to make a recommendation to the Travis County Commissioners Court. And just as a reminder, the Commissioners Court not only sets our tax rate, but they have the final approval related to our homestead exemption amounts also. So we will be back in June to provide some additional information. Part of the presentation was to alert you that we will be bringing forth an item for a decision for action. And in addition to that, we are working with the Travis County Budget Office staff, and we're doing a lot of data exploration just to look at some data ratios related to, I mean, everyone knows that Travis County has been a high growth area, and just looking at some of the taxable assessed values and the homestead amounts, and just looking at ratios over time, and looking at does it make sense to look at a little more consistent policy as changes occur both on the taxable assessed value side and the exemption side. So we will be looking at data related to that, plan on bringing some data back. I'm also hopeful that we're able to get data to kind of look at some of the taxable assessed values of homesteads that qualify, especially for the over 65 and disabled exemptions, just to have a little more information on who we're offering the exemptions also. We're also in the process of researching the changes and the impact of both to the taxpayers and to our property tax revenue related to any of the amounts that we may either recommend, or we'll probably try to bring some interval information to you related to, you know, here's the amount if we were going to increase the exemption amount, and here's the impact that would have. We still are researching some of that. We'll have to bring that back. So to wrap up, the item really is to tee up that we'll be bringing forward an action item in June related to the amount, and then to ask, are there any more data items that you would like staff to work on in order to help the decision-making process? And we don't need an answer tonight. Feel free, if there is some information to work through Perla, and we will certainly work on trying to obtain data from the proper data source and work through that. So that concludes my presentation. I'll turn it over for any questions anyone may have.
Thank you very much. Very helpful. And we look forward. We know that you will get your hands on every scrap of data you can, and we'll be analyzing it furiously with your staff. So we look forward to hearing back from you. Members, any questions? Yes, Manager Jones.
I just have a quick question. As always, do a great job in providing the profile of the city, the county. And AISD, do you have any information comparable for some of the other larger ISDs in Travis County, such as Pflugerville, Dell, Valle, Eanes, Round Rock, I think comes into Travis County as well. Do we have any data?
Yes, it does.
Look at that.
We can provide that information next time as part of the data that we bring back. So yes, I think that's obtainable, and we'll provide that for your information.
I just think it'd be helpful to be able to look at the impact those communities have as well with us as well. So appreciate it.
Sure thing.
Thank you both. Yes, more holistic view of Travis County. Thank you. Anyone else? All right. Well, thank you very much. And we will now move to item number 4 on our agenda. Receive an update on project plans to advance the Eastern Travis County service expansion. And we have very hardworking staff who will be presenting tonight: Stephanie McDonald, Elizabeth Marrero, Yvonne Davila, Rachel Toronjo. I think all will be presenting, so I will turn it over to you.
Thank you, Chair Greenberg. Thank you, managers, especially Manager Jones. It's great to see you. And while you were busy guiding the city of Austin through the global pandemic, the team here has been very busy putting the pedal to the metal in Eastern Travis County. We hope that the significant progress we've made in these projects is evident in the presentation this evening. Thanks. I really want to acknowledge the hard work of the team. The presenters tonight are the core team, and especially want to acknowledge the work of Rachel Toronjo, who manages multiple design teams, and Yvonne Davila, Isela Guerra, our fabulous community health workers who have been doing significant outreach in Eastern Travis County. And then as well as Elizabeth Marrero, who has been beginning to spend time at our new Northeast Health Resource Center. So next slide, please. I wanted to give you all an update on our work in the Colony Park area specific to the long-term Health and Wellness Center. And we, as you know, have been negotiating with the city of Austin to purchase a property within the 208 master development area owned by the city of Austin. We have agreed on a price. We are agreed in principle to terms and a local agreement that would allow for us to purchase that property, as well as a separate interlocal that would allow the city of Austin, Austin Public Health, and the Austin Public Library Department specifically to collaborate with us on preliminary design of a new health and wellness center to incorporate potentially those services on site. We did have a little bit of a hold. The city of Austin had a desire to make sure they had enough funding to build out the utility infrastructure necessary to jumpstart the Loyola Town Center that fronts Loyola adjacent to our property that we would purchase. There was some funding identified. That funding recommendation did not advance at the council level. However, staff has informed us that there are new ideas at the table. We have a meeting coming up, and they have let us know that they think that we could come back to the city council in June with funding to close that infrastructure gap. And I hope that I can come back to you all at the June meeting with an agreement for both the sale as well as advancing the preliminary design. And I'm going to hand it over to Elizabeth Marrero. So if you can go to the next slide, and she can tell you a little bit more about what's been happening at the Northeast Health Resource Center. Elizabeth?
Hi, good evening. So we did open the Northeast Health Resource Center on the 29th of March. So we've been open for a couple of months now. We got a great response from the community for the opening, and it was virtual and on Facebook. We were able to promote it with a video, and we did get a lot of support from the school and staff and have continued to get support for our work there. The location is accessible and it's close to a bus stop. We've had several clients walk to the site, which I think is a big plus since transportation issues have been brought up around that area. We are working on increased signage to continue the visibility and so people know exactly where to go. And then we're still working through some connectivity issues on site. And we are working on internal planning, continue planning for programming and strategy and future partnerships as they keep developing. We are participating in several parent groups. The school has been kind enough to let us sit in and have 10 minutes at every parent meeting. And every time we've met with them, we've gotten an increase in people coming to the site. So I'm going to go over some of the services that we have currently. At Barbara Jordan, we have MAP basic enrollment. They are averaging about 20 appointments a day. And they are taking walk-ups. People are coming for questions. We usually get about 5 to 10 people a day coming in just for MAP applications and for questions, and that has steadily increased. So I think that's a really good thing. We are also doing in-person community resources and referrals if people have questions that are outside of MAP or struggling to make appointments with community care or want to know how to do that. A staff that is there has the ability to make appointments in Epic and have made appointments for them as well. We also have WIC that is coming out with their mobile unit every third Wednesday of the month in the morning. We've also increased our diaper and menstrual supplies for the community through the Austin Diaper Bank relationship that we have. And then we have started Book Spring has been providing us books just this week, and so we're providing books to children whenever they visit and are supporting that. We are still working through having the Overton site be a community space that nonprofits can use for meetings and classes. Once we get the Wi-Fi working there and complete some of the conference space ordering like tables and chairs, we'll be able to promote more sites and classes there. A lot of community groups are still providing virtual services primarily. We have seen an increase and slowly with them offering in person. And if you want to go to the next slide. And so just some of the activities, I'll let Yvonne Davila go into into more detail, but we did participate just recently. We had several Central Health staff participate on the May 7th and 8th with the Colony Park Block Walk. We provided 200 Central Health bags and PPE with information, resources, and a way to contact the Northeast site. They were able to, in total, 382 homes were visited, and volunteers met with 181 residents to gather information and concerns. And then we are going to participate on August 6th on the Colony Park Back to School Bash. Yvonne?
Thanks, Elizabeth. Thank you so much. So as you all know, when it comes to our outreach efforts, we follow a logic model based on the theory of change to ensure that our tactics and activities directly correlate with our desired outcomes. For the launch of the Northeast Health Resource Center, we use the tactics that you see on the screen. In collaboration with community leaders, Central Health, namely, special thanks to Anastasia Sims-Mitchell and Edwin Evans, pre-recorded and held a virtual grand opening on Central Health's Facebook page, March 29th at 11:30 in English and at 1 o'clock in Spanish. The English version had 277 views and the Spanish version had 90 views. Prior to the virtual grand opening, we sent email invitations to our list of now more than 6,000 contacts, which includes stakeholders who live in Colony Park and Lakeside. Also in terms of social media, promoting the services of the Northeast Health Resource Center via social media is an ongoing affair. Aside from the promotion of the opening of the Northeast Health Resource Center on social media, our multimedia content specialist, Anastasia Sims-Mitchell, has been working with Elizabeth Marrero to highlight upcoming activities at the center as a way to draw attention to the center throughout the summer and leading up to Colony Park's Back to School Bash on August 6th, like Elizabeth mentioned. Our outreach and engagement team has been sharing information about the Northeast Health Resource Center on a variety of Facebook groups, including the Colony Park and Lakeside Neighborhood Association Facebook page. And as we've shared before, we've been sending weekly emails since last summer. And of course, we've been sharing information about the Northeast Health Resource Center in these weekly emails. These weekly emails go to about 600 of our most actively engaged community members, including neighborhood association presidents, community health champions, and advisory committee members. In terms of signage, so the address of the property leads people to the entrance of Barbara Jordan Elementary, which is off of Johnny Morris Road, but the Northeast Health Resource Center is accessible via Loyola Lane. We're in the process of getting signage produced and installed to let people know where the center is actually located. We're also producing and installing feather banners to place along Loyola Lane to draw attention to the center. Elizabeth already mentioned, thanks to a collaboration with Cortez Consulting, the Colony Park Neighborhood Association, the City of Austin, and volunteers, including Central Health staff, we engaged in a community block walk effort going door to door. And Elizabeth already mentioned the numbers that that effort brought about. So with that, we're gonna keep going to the next slide. And the next few slides are around our engagement efforts for, as it pertains to some of the projects that are a little farther along, the long-term projects that are a little farther along. As you all know, through systematic community engagement methods, our goal is to involve residents in the planning, implementation, and evaluation of central health projects. What you see here on the screen are the tactics that we use to engage with residents to gather their feedback. We then rely on communications and outreach tactics to ensure that we're involving our consumers in the public participation process. Specifically, to inform and obtain feedback from consumers and patients, we use online and paper surveys and one-on-one interviews, either in person or by phone. To inform and obtain feedback from the community at large, we use community advisory committees and community conversations. Next slide, please. This next slide, this slide is around the Del Valle Health and Wellness Center as a project. And as you see on the screen, we had a community conversation where we shared site concepts, project timelines, and ways to get involved and provide feedback on the site features and the amenities. This community conversation took place on February 25th. We had about 20 attendees, but since then, there's been about 400 views of the English version of the community conversation and around 145 views. Now, this is about 2 weeks ago, so the number of views might have gone up by now. Next, we have another community conversation for the Del Valle Health and Wellness Center, and it's taking place June 8th, where participants will be seeing a virtual tour or taking a virtual tour of the completed design based on community input and project parameters via Facebook Live. Again, this will be taking place in English and then in Spanish, as you see on the screen. I mentioned earlier that during the first community conversation that we had on February 25th, we let people know how they could get involved and give us their feedback. This was via a survey, and it was an online survey, and it was also a survey that our own staff, thanks to our outreach staff, like Stephanie mentioned earlier, our community health workers led by our very own Isela Guerra, we were able to actually conduct over the phone interviews with MAP members. And so what you see on the next screen please, is the outcome of the survey for the Del Valle project. And so we work with our data analytics team to ensure our target numbers for each focus area were statistically significant. The objective of the survey was twofold: gather feedback around indoor and outdoor site amenities for each health center, and gather feedback around social indicators, which were based on the health needs assessment included in each of the project plans. This meant tailoring each of the surveys specific to the needs of that community. Having said that, as you see on the screen, for the Del Valle Health and Wellness Center, we had 264 participants who completed the entire survey. And as mentioned earlier, we highly value feedback from our consumers and from our members. So thanks again to our outreach staff, we made a concentrated effort to call MAP and MAP Basic members living in these communities. And as you can see on the screen, 38% of participants were non-MAP members for this project. And these are folks who completed the survey online, and 62% of them were MAP/MAP Basic members. And as you see on the screen, in terms of zip codes, 60% of respondents live in 78617, 7% live in 78725, and the rest were from a long list of zip codes. And you can see also the breakdown in terms of race and ethnicity. Just a couple of highlights. the distribution of race and ethnicity among MAP and MAP basic members who responded to the survey is more similar to the underlying demographics of the Del Valle enrollees. And in contrast, non-member respondents were more often white than either the Del Valle enrollees or MAP basic respondents. And our staff is currently digesting all of the information that we gathered from these surveys. Next slide, please. This is just around the Hornsby Bend project. So we took a similar approach to the Homestead Exemption project in that we had a community conversation where we shared the site concepts, project timelines, and ways to get involved, meaning the online survey, to provide feedback on the site features and amenities. And this one took place March 4th, where we had about 30 attendees, and you can see the number of views that we've had since then, as of 2 weeks ago, actually, for this community conversation. The next community conversation for the Hornsby Bend Health and Wellness Center will take place June 10th. Participants will take a virtual tour of the design based on community input and project parameters. And you'll see that. And you will be receiving emails related to these community conversations. In fact, we sent the first email invitation last Friday, so you should have already received an email regarding these two events. Again, these events will be taking place via Facebook Live. And whether or not you have Facebook, you can still see these events or participate in these events because these our page is public. The next slide is the breakdown of the survey for the Hornsby Bend community. So you can see that 252 people completed the entire survey, and you can see the breakdown of MAP versus non-MAP participants, and the breakdown of zip codes. The majority of the zip codes, about 90%, were either from 78725 or 78724. So both of these surveys were highly targeting the people living in those communities, and highly targeting, of course, also our MAP members. And so you can also see the race and ethnicity breakdown on the screen. And that concludes my portion of the presentation. I will then pass it on to Rachel.
Thank you, Yvonne. Good evening, Board of Managers. Rachel Toronto, the owner representative project manager. I'm happy to join you guys this evening to give you kind of a high-level update of where we are at in both projects and design. So this slide is a kind of high-level milestone timeline to show you kind of where we're at and the expected milestones coming up. So anything that you see in gray is a milestone we've already met. As you recall, we sort of rendered up our concept design for both projects in mid-January and brought those concept designs to the Board of Managers along with the project approvals for approval at the end of January. We then kind of moved very quickly into schematic design, and we're able to wrap up the schematic design for both projects a little off target from each other, but in concurrent with the timelines for the individual projects, wrapping up in Hornsby Bend in February and following shortly after at Del Valle. What is identified in orange is kind of where we're at. We received both the design development packages. So that's really just a level of design where you have taken the schematics of the floor plans and started to build out all of the architecture and engineering features of the facilities. So we have received both of those packages on the projects and have actually just wrapped up our internal review, and we'll be moving into sort of the final phase of design, which is called construction documents. We expect to wrap up that phase for both projects mid to late July, and we'll be issuing the expected final construction contract issued this fall. Next slide, please. So going into the Del Valle project, this is an exterior sort of model rendering of our Del Valle Health and Wellness Center, working on this project in partnership with our design team at O'Connell Robertson. Next slide, please. So this is the site plan for the Del Valle project. And just to orient you to what you're seeing on the slide, This is the building is at the corner of Elroy and Ross Road in Southeast Travis County, directly adjacent to Popham Elementary. The building faces Elroy Road, which is a slight eastern, slightly southern facing direction of the building, with Popham Elementary being to the slight northwest, and Ross Road on the southern orientation. So this site plan shows that we have access from both Elroy Road as well as Ross Road. This kind of goes into some of the schematic level landscape architecture. So it'll show you the community gathering space that we are planning as outdoor space for the community, as well as to the right side of your screen, you'll see a drive-through for the retail pharmacy that you'll be able to identify in the next slide. Next slide, please. So this is, it seems like a really busy slide, but I pulled this image directly from our design development document. So this is actually from one of our architectural sheets. I wanted to pull this particular image because I think it shows you just where we're at as far as the level of detail in the architectural and engineering design where we're at for the facility. So I'm just going to do really quick high level sort of walkthrough just to show you the general areas in the facility. So if you look to the top of the screen, that's the primary entrance to the facility. Again, that's what faces Ross Road. We're showing sort of that open area from the primary entrance is a joint sort of waiting area for all services. So we're doing a shared check-in at this site with information desks to help patients navigate through the building. At the lower right-hand corner of the screen, that's where our dental space is being designed. So we have both adult as well as a pediatric dental bay in this facility. Directly to the top right-hand side of the screen as well, that is the retail pharmacy. Again, going back to the site plan, you would see the drive-through, as this will be a drive-through retail pharmacy. And then most of the areas to the left side of the screen is the clinic space. So this is the comprehensive primary care with integrated behavioral healthcare space with some pediatric exam rooms as well. And we're also showing a multi-function room for community services and spaces that has connectivity to that outdoor space that we are designing in for the community. And on the far left-hand side of the screen, that is some additional square footage that we will have for future building programming that we can program out as we move into the future of this facility. So it gives us some future flexibility. Next slide, please. So these are some interior design renderings, the next couple of slides for the Dell Valley Health and Wellness Center. So this is upon entering the facility, this is our shared waiting area with the information desk and the check-in desk as well. We have some community resource stations built into this area, and that's what you see kind of over kind of in the middle of the screen with the green framing around it. Those will be some computers for community use for availability to access online services. And the windows that you see kind of closer to the left hand behind that information desk would be the retail pharmacy. So pick up windows inside the building for the pharmacy space. Next slide, please. So this is an interior, again, design concept rendering of the dental clinic. This is showing the adult operatories, and you can see directly kind of at the forefront of the image, that's just a little piece of where the care team will be working. Next slide, please. This is the interior rendering of the clinic side. So what we're looking at here is the care team, so collaboration space, as well as some private collaboration space directly behind the open care team area. And the exam rooms and the procedure room would kind of align this space. As you see on the far left side, you can kind of see that wall that would be lined up with the exam rooms. Next slide, please. Okay, so going into the Hornsby Bend Health and Wellness Center. Again, this is sort of a model 3D rendering of the building exterior. working in partnership on this project with our primary architect and engineering firm of BSA Life Structures. Next slide, please. Thank you. So this is our preliminary site plan for Hornsby Bend. We are still working on some changes to this site plan, but again, I wanted to bring this in this presentation to show just how far we've gotten in the site plan development for this project. This is on the 10-acre site that's in Hornsby Bend, directly across from the Daly Middle School. The building orientation faces north towards Gilbert Road, and you can see Sandifer Street sort of curves around our entire property. So we're looking primarily to develop that part of the property that faces Gilbert Road. Thinking about drive-through access, especially lessons learned from COVID. We understand how well drive-through events work for the patients we serve and for the communities we serve. So we wanted to make sure that we are thinking through the availability to do that and making that more easily done with our projects. So that's how you can see there's an entrance from Sandifer, and then you have sort of a nice clean exit all the way to Gilbert Road, having access on both sides. We're also identifying on the site plan some potential amenity areas and where we would locate those in proximity to the facility. Again, just really trying to build out some of the community spaces, both indoor and outdoor at this facility. Next slide, please. So again, pulled directly from our design development package. So this is going to show you a lot of the architectural details, at least from one of the architectural sheets. There are many. And just kind of orientate you through the building. The primary vestibule is right there at the top of the screen. Again, that's the north-facing part of the side of the facility that faces Gilbert. Upon the primary entrance, we have the joint check-in, reception, check-in area, and we're showing some separate waiting spaces. We're trying to design in a sick waiting or waiting for the other side of the facility, which is kind of more of community spaces. Directly behind that reception and check-in is the clinic spaces. So pretty much what is on the left side of the floor plan is all the clinic spaces where you'll have your exam rooms, the care team, and all of the support spaces that you need. On the right side is primarily the community spaces. So we're showing, again, the community workstations, similar to what you saw in the interior design rendering at Dell Valle. We have a conference room that we can use by the community, as well as some office spaces for potential partnerships, and a large community room to provide access to that community room for the community for all types of services that we can program out of that space. We'll also, I just want to make one note, be adding in some exterior access to that community room so that we can have events there if in the event that the clinic, during non-operating hours of the clinic. So it can function sort of as its own facility. So we will also on that site plan be building out some of the exterior access to that as well. The back of the facility is primarily just the support spaces for the facility. So where we're locating, mechanical room, electrical, all of those sort of building function spaces. Next slide, please. So for Hornsby Bend, I really wanted to pull some of the 3D models. So this isn't going to be sort of interior rendering. This is directly from the model that we and our design team are using to build out the facility. So this interior image is from again, that check-in. So you can see the primary vestibule, the entrance of the facility, and both sides of the waiting. And this has an elevated roof line. So we really wanted to bring natural light into the building. We understand it's a clinic, but natural light, really just brings in sort of that feeling to the building that the community identified as being a key priority for them in the survey, just natural light. Next slide, please. So on the left side of the screen, this is just a different viewpoint from that shared check-in. So that is the front check-in desk, and you can see one of the waiting areas off to the far left. On the right, this is the care team space. So again, another sort of pop-up in the roof line where we can bring natural light in actually to the clinical space itself. Oftentimes that's challenging in medical facilities. They tend to be dark and you don't get a lot of natural light in, and that was something that was key to the community. So we wanted to make sure we accommodated that. Next slide, please. And I really just wanted to add this in because it's really kind of neat. Again, this is straight from our model. So this is obviously a 3D rendering pulled directly from the model. So it's sort of a slice going through horizontally through the building. So what you're looking at is, again, that primary vestibule and entrance with the waiting areas, those workstations and the conference room. So it's kind of slicing off the first third of the building and looking into it. And again, this is just to emphasize how far we've gotten in the design of these facilities. What you could see in that plenum space, or the space above the ceiling, is all the mechanical systems and electrical systems that are actually in our model where we're at in design. Next slide, please. So with that, I will wrap up my presentation and I'm happy to answer any questions.
Thank you, Rachel. So managers, I do want you to know that, as fast as we're going, we have hit a few speed bumps. And I think you all are very well aware that construction is at an all-time high in not just Austin, but in the country. There is record demand and record prices on both labor and materials. We already know that the estimates are going to come in higher than what we budgeted in their initial project plans. I think you're going to get a little bit of a window on that in Lisa's presentation. I'm literally going to pass the buck to Lisa to talk a little bit more about the money and the funding. I think we're in good shape though overall, and like I said, we're very happy to answer any questions you might have.
Thank you so much to you and the presenters and your entire team and those who we can't see or hear from and thank tonight. The progress is just wonderful, and we look forward to hearing more about that property in Colony Park with the city when you're able to discuss that, and happy to know that you've resolved with the city on that. I know that there have been a lot of things that have been outside your control for some time, and we appreciate the progress. This is of such a high priority for us. And I want to thank everyone for the presentation. Very complete, very thorough, and very much appreciated. Members, anything? Manager Musaitis?
Thank you, and I concur. Great presentation, very thorough. I have a quick question. In the design, do you have a radiology department? I don't know if you've covered that or not.
No, we don't. Not for these two sites. These two sites are relatively small. I believe we've less than 7,000 square feet of clinical space at Hornsby Bend. We have about 15,000 square feet at the Dell Valle site. Right now in the community care system, and this is really an operator decision, right? But in the community care system, there are only 2 sites that have imaging, and the radiology at Southeast Health and Wellness Center and North Central. So those hubs are right now where, if you need those services, you have to go as a community care patient. Now we are looking at Colony Park differently, and I think more to come there. And we have already made a recommendation, for example, that would be a good site potentially for mammography. So
if I may, thank you. I think mammography and radiology is somewhat different. Now, if a mother has a broken, like if a kid has a broken arm, where do they go? In Eastern Travis County. So that's the question that I hope we can answer. And if we are building these facilities, which is wonderful, amazing, I think in terms of equity, we need to at least have this. And it's an ask from the community. And as a mother, it's a must, because where do you go, especially if you have transportation access and a lot of barriers. So as simple as that, I think the community deserves that, and we need to include it in our design, in our buildings. Thank you.
Thank you. I know Ms. McDonald mentioned that this is a provider issue, and community care is the provider, correct?
Right now we are in, that is the presumption that will be the clinical operator for both sites.
Will be the clinical operator. So that I think would be a discussion point with them. Managers, other questions, comments? Manager Valadez.
Yes. Yes. Thank you, Maron, for bringing that up. I agree, because if you look at any side, the 183 or one going side of I-30, which is the toll road, there aren't going to be any places that anybody can go if they have a child with a broken arm. If the parent comes home from work at 7 or 8 o'clock at night, they've got something wrong with them and they need to have access to radiology. Something needs to be there, and you'll find that those have an overabundance of mothers and young families with lots of children. So in the clinics, we're going to have to accommodate that, because that's going to be looking at the needs of the demographic and the needs of the community in those locations specific. Now, they're both located outside of the city of Austin. So it's easy for us to be able to say, oh, in Colony Park, we're going to give them more land, more space, we're going to do more amenities. But they're part of the city of Austin. They've got built-in infrastructure. And in Dell Valley and Hornsby Bend, they don't have any infrastructure. So those are the key issues that those communities came to us about. We do not have infrastructure. We do not have access to those things. And that's something that we need to address. We made it to them that we were going to look at incorporating some of those things in that area, so they wouldn't have to go all the way into Austin to access these things. So I really do think that Central Health and community care really need to look at that in innovative ways to be able to provide at least some of those services to the needs for the needs of those communities. Thank you.
Thank you, Manager.
And other, I mean, it's a beautiful space, but my concern as a parent is going to be when I'm sitting there and I've got 5 kids, what do we have for them? And if I've got multiple issues with my kids or with myself, even more important, then how is that going to be addressed? And I think that those are important issues that parents have to look at, and are complaining about. Not having equal access to the same kinds of amenities that are afforded to other areas where infrastructure does exist. And we have the ability to work with other governmental entities like the City of Austin, but we don't in those areas. So that's something I think really, really needs to be looked at in an innovative way. Thank you.
Thank you, Manager Valdez. So just a couple questions for staff. Since community care is provider.
Jones has a question.
Excuse me?
Manager Jones has a question.
Right, I will get
okay.
to Manager Jones. I had a question. Yes, thank you.
Okay.
A question for staff, given what I've just heard from Manager Musaitif and Manager Valadez, and then I'll get to Manager Jones. Thank you. My understanding is, and this is for anyone on staff who is able to answer it or perhaps get back, but community care doesn't do urgent care. Is that correct? So currently, there's nowhere that community care, and believe you me, I understand, having taken my own children multiple times with broken bones, and it usually happens when they're doing something like, oh, I don't know, playing soccer in the dark, and so it's at night, right? I do understand this, but I don't think that the community care currently does any kind of urgent care or does casts or anything. So it sounds like this would be more of a type of freestanding, or I don't know, it would be an urgent care kind of situation. And how would we be addressing that? I'll just pose that question.
Yeah, I'm glad that my colleague John Morgan has joined the line. I do want to mention that we do, as MAP members, MAP Basic, do have access to urgent care as part of the benefit, and John can tell you about those locations. We fully recognize those locations are not in Eastern Travis County, and we will work on that. I think the closest one is on Riverside, and then there's one at Miller as well that I believe is the 2 closest to the Eastern Travis County.
So Stephanie, I know we've had this discussion before, and Cynthia, you may remember several years ago that this is an ongoing challenge because the And I know a few years ago we did enter into contracts with additional urgent care providers, but it's difficult because there's a dearth of providers in some of these areas that we're looking to. So we had no one to contract with. Perhaps John Morgan can address this.
And John, could you also talk about where imaging services occur right now? Thanks.
Oh yes, please do talk about radiology. Thank you.
Absolutely, and I'm probably just going to confirm a lot of what's already been said. Today, urgent care is not something that community care provides. As you all know, they do have several walk-in sites and do offer some after-hours access for convenient care purposes, but I can't remember who said this, but community care currently does not do casting. So casting and broken arms, that type of scenario would be through urgent care or through our emergency departments at the hospital, ideally through urgent care. Chair Greenberg, as you said, we've not been able to partner with urgent cares in some of the more remote areas of the county, mainly due to the population density. Those providers have not built facilities in those areas, although we continue to reevaluate opportunities to contract in the network, and we are continuing to explore other urgent care opportunities as well. But imaging today is mainly through the two sites that Stephanie mentioned, so Southeast Health and Wellness and North Central, as well as the urgent care and emergency department facilities.
Don, did you want to mention the ARA?
We do have an agreement with Austin Radiological Associates. We also contract with the medical school related to expanded imaging services today. Those are targeted specifically at screening mammography. They're not marketed routinely to our patients for urgent care purposes as a standalone imaging site.
But the ARA contract is for urgent care or
no, ma'am, just for screening mammograms.
ARA is for screening mammograms. Okay.
And then, and I'm sorry to interject, Madam Chair, but then there's the recent relaunch of the pink bus that we are reimbursing Lone Star Circle of Care for mobile mammography services.
Okay, good. Yes, I do recall that the pink bus is back in circulation. Manager Jones, I know you had a question or comment.
Well, I have a couple of things. One is just to piggyback off of what Manager Masaitis and Manager Valdez says. I think urgent care needs to be revisited in terms of the density that is occurring out in Eastern Travis County. It's no longer a rural area. In fact, if you look at the demographics in terms of numbers, Eastern Travis County is growing as fast and as rapidly as other parts of this county. So I'm not sure where we are in terms of assessing that, but I think it's important. That's the first thing. Second thing is on the presentations of both Hornsby Bend and Dell Valley, I saw a drive-through pharmacy for Dell Valley. I didn't see one for Hornsby Bend. Is there one in there? If not, why not?
That was a decision by the clinical operator. They do not have the patient volume to support a retail pharmacy in Hornsby Bend. Clearly that can change, and I think that is part of the reason why, that site, we're trying to make it as flexible as possible. I think, and if you saw, if there is a future expansion, it would be on that side where the community resources are, and we would move out that way. I do think that, this is a tension point, and I have a lot of respect for John Morgan. He has to contract with our operators, and we are not in the business yet, and I say yet, but we do not provide these services, and we have to basically incentivize our providers to do this work. So I don't think that they see the demand and the volumes for the drive-through pharmacy in Hornsby Bend. We did, we certainly talked about urgent care. We explored that option early, and I think if there is an opportunity in the future for community care to enter into that space, we would welcome it. If there's another provider that would be in those areas, we would certainly want to contract with them. And then the pharmacy question is really an operator decision. There's a lot of infrastructure, there's a lot of staffing required, and you have to have enough patient volume in order to make that work.
Well, I appreciate that, and I certainly understand where you're coming from, and respectful of that. I do think that's going to grow over time, and I expect that you will revisit it. I think it's also related to the fact that Hornsby Bend seems to be twice as small as Dell Valley in terms of size. So I assume you did some assessment in terms of demographics to determine that. I don't know if I would agree with that, but I grant you've done the data, so I'm not going to question that at this point in time. My last question relates to, and this goes to Mr. Giesland. When I mentioned to you, I'd seen a rendering of the Hornsby Bend from an aerial view. It looks a lot different than what I just saw. So my question is, have we changed what we had put out maybe a few weeks or a month ago? I forgot when I saw it, from what we currently have now, because I didn't see an aerial view, so it maybe is the same thing, just looks different. But it looked like there was I won't say a moat, but something going up under the location. I'm just wondering, is this the same rendering that we've had the whole time?
Ultimately, I'll defer to Rachel on that, but there is a drive-through area in front of the clinic, if that's what you're referring to.
Well, this was an aerial view looking down on top of the facility, and it looked like there was a creek or something running underneath, but maybe I saw it differently. I'll go back and try and find that rendering.
No, so there's not a creek. There are some low-lying areas on that piece of property, but that's obviously subject to change once you start going in there and doing the grading and the dirt work and the retention area work. But again, let me just defer to Rachel because she knows these drawings frontwards and backwards on this one.
Yeah, so as far as the building, the aerial rendering you're speaking to, we have not changed the building from that rendering. And again, that rendering was pretty much directly above. So what you saw that I showed today is sort of looking at the building from, almost like a 45-degree angle. So it's going to look different because that aerial view, there's a large canopy that goes over the 2-lane drive for patient drop-off. So that's very different view when you're looking at it from the top down. Also, that aerial view identified some of those site amenities so there were, on that area rendering potential fitness trails, as well as the outdoor activity area, the children's playscape, community garden. So a lot of those early concept site amenities that are still in, but you're not going to see on the site plan for submittal site plan.
Would you happen to have the aerial view handy right now? If not, I mean, I can talk about it later. I just didn't know. I agree. I think that's the answer to the question. It does, that drop-off area looked from the aerial view a little different.
Rachel, I have a suggestion, and that would be, can we find a time where you can get with Manager Jones and look at with him at the aerial view and these different things? I think that would be helpful and will allow you to pull that information together. And if you could schedule for the two of them, if that's acceptable to you, Manager Jones.
It'll be fine, yes.
Okay, thank you. And I do want to make sure, Stephanie, I think that we've heard some very important points here. One, on the pharmacy, that we have the flexibility for the provider, and we're looking at community care being the provider to add the pharmacy when, if and when the population density allows pharmacy operations. The building is built in such a way that you could add that pharmacy. Is that correct?
Absolutely.
Okay, and then the next issue is this ongoing issue of urgent care. And I would just ask that we look to see if put our thinking caps on, if there are any creative opportunities out there that we may not have thought of previously any creativity as far as other providers or potential providers who may be out there, because this is an issue that we have, a challenge that we've had for some time. So I would ask that we just look at and talk to folks about, you know, is there something else creative out there, or some provider that we didn't know of, or something along those lines, please. Manager Musaitov and then Manager Valadez.
And Manager Jones also had his hand up. I just want to know if an elderly person fell, where do they go in that community? Where do they go? And I think we're here, and they've asked for it several times, and we need to think about one size does not fit all. Yes, community care is not in the urgent care business, but this area needs the service. So, and even if, and as someone said, if these urgent buildings, emergency buildings are making revenue money, they would have been there. Obviously, they're not, so they're in the business of making money. We are not. We're there to provide the care and the services they need when they need it. So where can they access that care? So that's really.
So again, my request.
That question.
Yes, Manager Musaitov, I appreciate that. Again, my request is if we can go back and see if there are any creative solutions or opportunities to this challenge. Manager Jones, did you have something else that I missed?
Question, is there some way we could get an assessment in terms of density, in terms of the utilization at the pharmacy anticipated in Dell Valley versus the decision not to do the pharmacy in Hornsby Bend in terms of comparisons of density? Because the location of the Dell Valley one is not in a very highly densely populated area, any more so than.
So, Manager Jones, we're having trouble hearing you, but I think what I have heard is, and again, this is something that probably it would be good if staff could get with you on and then provide the data to everybody else too, of course, and that is the demographic data vis-a-vis these different locations and the pharmacy provision. Is that what I heard, Manager Jones? Okay. All right, let's go ahead and set up, if it meets with your approval, a meeting with you, but also then when staff has pulled this information to provide it to all of the board members, you know, the demographic.
And Chair Greenberg, I just want to point out that some of this was in the preliminary project plan documents and the data set that came with those project plans. So we do know what the patient population is. We do have some, you know, pro formas that community care is still working through. At some point, you know, we hope that we could, you know, come back to you all with some of the updated business model, but it's for a future meeting.
Yes, I knew that you had done that demographic work, so I thought that you could share that with Jones. It would be that he would like to meet with somebody, and again, Parallel would organize that, but also to send that information out again to the managers. Exactly, that's what I was alluding to, Stephanie. Thank you. Manager Valadez, did you have something?
I'm glad that Shannon is back, and I would like to make this a request that we have a strategic Eastern Crescent meeting, that this first items that we address, and also revisit with the communities and let them know that this is what we have been presented with. I don't know that they have seen them. They may have. Stephanie, have they seen these plans? Okay, but maybe it would be a good opportunity for us to have an additional maybe community meeting with them.
Well, we have community conversations scheduled, right? So June 8th and June 10th are coming up.
Oh, great.
Yes, we do.
Okay, okay, that's going to be perfect. But that's going to be perfect. But I would personally like to see this as an agenda item for our next Eastern Crescent subcommittee meeting.
Okay, I think as far as the Eastern Crescent. I will, and the subcommittee, I will defer to Manager Bell, since that is a subcommittee of strategic
planning.
So I'm going to, so that is something that.
But I do believe that what we're hearing is that there are continued concerns that have historically been brought up to us and thrown in our faces, and we promised that we would accommodate their needs, and we need to accommodate their needs however we can. as best we can, you know, and if we cannot do it, then we all and we need to be on the same page so that there is no blowback before we get building begun. Okay.
Absolutely. Appreciate that. We need
Thank you.
we need complete transparency and communication. I know that there have been ongoing communications and committees and task forces with these projects, and that we have more meetings scheduled, but appreciate that. Mr. Giesler.
Yes. If there's no other board questions or comments, I want to try to summarize and put some perspective on this. So first, when you're talking about the pharmacy, there's a difference between a retail outward-facing pharmacy and a pharmacy that is, and forgive me what the class number is, I don't know if it's Class D, that is internal to the clinic that serves the patients, which is not unlike what you see in community care centers today, as well as other FQHCs. So distinguishing between drive-through retail versus internal to the clinic is one issue. The second issue is really a completely, they're somewhat apples and oranges in that you're talking about an urgent care model versus a primary care model. And when you look at the vast number of encounters that we have in primary care, the data, as well as the community input, as well as input from the providers, points to primary care and all the different encounters that fall under primary care. If where the board is wanting to go is an urgent care model, which is different from primary care, then that is a separate discussion altogether. And I don't think that it is, and I'll look to staff to chime in and offer some alternative perspectives. We have space to do that here if I'm not getting it right. But really what we need to do is come back and talk about urgent care and what that looks like. I don't think that necessitates delaying these projects that are underway, again, because it's two completely different types of treatment models. I think if we were to delay these projects, given that the marching orders were work with the communities, work with our patients, work with providers, get going. We've done that, here we are. I would not recommend delaying these projects for an urgent care model discussion.
Thank you, Mr. Geeson. I will not speak for everyone on the board, but I know that several of us who have been here for a while have stated that we do not want to do anything to delay these projects. So we certainly do not want to see any delay in these projects. And I appreciate what you're saying. And that's why I asked if staff could go back and look at this whole urgent care situation. Again, it has been an ongoing challenge, the urgent care, and perhaps, and I agree that we need a separate discussion on it. And perhaps there are some creative things out there. But yes, we do need to move forward expeditiously as we have been, with no delays in these projects. And then we can look at within our work plans for staff and our scheduling, and perhaps through strategic planning, although I will leave that to Manager Bell to discuss with staff, is if there is a way to come back and discuss urgent care after staff has had time to look at if there are any more creative opportunities for these urgent care challenges. Thank you. Manager Valadez.
Last comment from me, and that is, I look at this as the energy for building a road. And the dadgum roadway put up, you already several years, that's already outdated several years because of the growth that has occurred that was not necessarily anticipated. And so what I don't want us to do is get stuck in this model, but I'd like for us, and I don't think we will, because we've got a lot of innovative thinkers at the table at Care and the University of Texas and with other entities that could probably come together and think of some modified model that we would be able to, how we would have the flexibility to move that into something else should the need require it within a relatively short period of time.
Thank you.
That's all. Thank you.
appreciate the input and discussion. Managers, is there anything else on this item? There is no motion necessary. If not, then we will move to the next item on our agenda. And thank you for all of the hard work and presentation and time from staff. And I know there are some items that you're going to follow up with that, and that Perla will get with staff and Manager Jones. And if other board members, of course, have follow-up questions, contact Perla, and she will look at the appropriate staff and how to organize getting you the information you need or someone to discuss your questions with. Thank you. Right, we will now move to item number 5, receive and discuss a presentation on Central Health Capital Reserves, capital planning, and project to date updates on major capital projects approved by the Board of Managers. Lisa Owens will be presenting. Lisa, I will turn it over to you.
Thank you. Can you hear me okay? I had to switch to my headset.
Yes, I can hear you.
Okay, great. Okay, and Jeff's going to join me as well presenting.
Thank you,
but okay, well, we wanted to provide some information about where we are in our capital program and our capital budget year to date. Also be filling you in on where we are with the specific large projects that we just talked about, and then take a longer term look as we go into our budget season. We're preparing to bring you a draft budget in early June, mid-June, and so the long-term planning for our capital program and the cash reserves that we may need versus debt financing capabilities are a major part of that. And so this is also just in preparation for the budget. So with that, I just wanted to recalibrate everyone back to the budget that we approved last year. And for our newer board members, we do maintain a capital reserve. It's one of our reserve policies. And we use that for cash funded projects, not only just ongoing operational projects, but as we've started to do larger capital improvement projects as well. But any of our capital needs that could come up either in clinical services, the campus redevelopment obviously is a large initiative, and then the electronic health record has been a large initiative, and then other capital projects. So we estimated that we would start the year with $6.2 million in that reserve. We did anticipate a large transfer in this fiscal year, some uses of funds, some possible debt financing, either through a line of credit or other debt. And then we have an estimated ending balance that we anticipated. And again, this was going into this fiscal year. So I wanted to just let you know, where are we today? So a lot has changed, as you know. A lot of great work has happened, as we just heard. A lot of large projects have been approved by the board over the past few months. So this just shows you what we estimated we would have in the capital reserve at the beginning of the year and what we actually had. So $6.9 million to start the year. And then we also had budgeted to transfer $34 million, predominantly $27.6 million of that is for Eastern Travis County projects. This next column shows you what we anticipate actually transferring this year. And the reason I just wanted to highlight this is when we talk about debt financing, we have a line of credit and we are in the process, as you know, of issuing certificates of obligation. So we do not anticipate transferring for the Dell, Valle, and Hornsby Bend project this year the amounts we had planned, as we anticipate those certificate of obligations to fund that. But we will transfer some for that Colony Park project, which at this point is still anticipated to be using cash reserves. And just know those things change. But as we go into this year, then we do have spending that we think we will see, $4.8 million, and then an estimated year-end reserve. So that's kind of just where we are with, again, the reserves. But I also wanted to just talk more specifically before I hand it off to Jeff about the Eastern Travis County projects. So as you heard, we've made tremendous progress. We were before the board last September to talk about using some of our pool contractors for key professional services so we could expedite that work. And we have done that. But as Stephanie and I think you all know, but Stephanie mentioned, things are becoming more expensive and demand is becoming higher. So while we're still within our project budget, we did have a higher than anticipated need on those pool professional services agreements. And we do anticipate that project budgets may need to be revised once we put our construction solicitations out on the street and identify construction partners. Specifically, as I've highlighted here in the next steps, what's coming next is construction solicitations for Hornsby Bend and Dell Valley. So I just wanted to really kind of frame up where we are on those Eastern Traffic County projects financially, because we do anticipate using certificates of obligation, which Jeff will hit on a little bit later. But we also anticipate that we may need to come back, and we would hope to do this in the budget process, that we would just roll into our overall budget process any additional budgeted funds we may need for the future success of those projects. And again, we will know more as we get the construction process moving. So just wanted to highlight that. And with that, I'm going to just share with you some information about some of our high-level projects. So we wanted to start bringing back to you what are the major projects the board has approved. You'll remember the Epic Electronic Health Record. That work is well underway, and we anticipate being, we are launched, we are live, but we will have some ongoing expenses for that project in future years. And then the Dell Valley and Hornsby Bend project, you'll see, I just wanted to provide you with, spent to date on those projects as of March 31st, as well as an estimate of where we think we're going to end the year. And I also just tried to highlight where we currently believe the primary funding source to be, so for those being those COs. And then the Colony Park Health and Wellness Center, again, still anticipating cash funding for that. So the $16.1 million budget that you approved in January is still in there, and we anticipate the next step on that project would be the land acquisition. And with that, I'm going to hand it off to Jeff to talk about Red River and the pending clinical services, as he's been leading the updates to the board on those projects.
Yeah, thanks, Lisa. Before I get to the other projects, the Red River and the clinical services and admin consolidation, I do want to just pause for a second. We've talked a lot about cost of construction, budgets, the need to possibly increase our budget. And I just want to assure the board and anyone listening that financially speaking, Central Health is committed to the Eastern Travis County clinics that the board has approved. And so regardless of the type of financing that would be used, the financing is not any sort of delay that may occur, whether we debt finance it or cash finance it. At this point, we took our best estimate related around debt financing. We may not have got the number exactly right based on the way inflation's trending. We will cash fund any outstanding remaining portion of that project. So I just wanted to pause for a second. I know we talk about high cost and the challenges of building in this environment, but that Central Health is committed to construct those clinics as quickly as possible. So thank you I just wanted to reiterate that. So I'm going to talk a little bit about the last two lines. As most of you know, we're in the process of realigning Red River on the downtown campus. That project has begun. The budget is almost $8.5 million. You see that the expenses are to date are a little over $1 million. The project in itself should be completed or is projected to be completed around the end of this calendar year. So we will have significant spend up through September. And I think you see that reflected in the $6.6 million estimate. And then the last line alludes to the administrative consolidation and clinical services facility at Hancock Center that we recently approved. We will be back at the next budget meeting on June 14th to present the budget. but our standing budget at this point is about $62.5 million. You can see that we've had just a little bit of expense related to the project just through some due diligence that we've performed. And that through the end of the year, we would project the acquisition of the building, and then we would starting the design portion of the renovation. And then you see on the right, just the far right on the columns on all the projects are the source of funding, the primary source of funding, whether it's for EPIC related, the line of credit, the $10 million line of credit that was approved, whether it's the certificates of obligation issue or cash reserves that are utilized related to the project. Next slide. So the next slide is a 6-year look at our capital projects. So you see sources and uses. And what's always challenging about a real lengthy look on capital is, what does it really look like on the out years? So really think over the last couple of years, there have been a lot of changes that have occurred, and Central Health has reacted to those changes and come up with the appropriate funding sources related to those capital requirements. But what we did is we took, to some degree, known projects and wanted to give the board a look at what the next couple of years look like, the next several years look like, but with probably more of an emphasis of the next 3 years, which would be fiscal year 22 through 24, as our projects construction begins and kind of the cash outlay by fiscal year. But again, we look at projects, we look at our capital budget as projects that have I'm going to call it an inception to date look. So fiscal years are important for us to look at, a cash flow perspective and a spend perspective, but we really want to look at it at the capital budget by project. So in other words, if we're budgeting a certain amount for a capital project, it's really over the life of the project, regardless if it's a 1-year project, a 3-year project, and just try to project out the construction spend so that we can adequately fund them at the appropriate times. So we don't want to budget for a multi-year capital project and advance fund it with cash and just have that cash sitting there. Instead, we want to utilize long-term planning and properly utilize our resources to deliver health care and construct the capital facilities that are required. So you see on this slide, again, on the top is more of the uses kind of over fiscal year of the projects. And then in the out years, you see a lot of the amounts are decreasing. And that's not saying that there won't be additional capital projects in those out years. There's nothing specific that we can point to at this time that's been discussed with the board or has been approved, but we do want to budget for ongoing maintenance of our capital facilities. And remember that not only do we have new facilities and existing facilities, but we also have facilities that we maintain that we're leasing through the arrangement with the city and the county. And then on the bottom of the slide, you just see the funding sources, the estimates by fiscal year on how we would fund the requirements. And again, it's a structurally balanced budget so that we're utilizing our resources effectively, where we're matching our funding sources with our spend requirements. Next slide. And so our final slide alludes to the certificates of obligation that the board has approved the intent to issue. And so there are two series within the issue. The first series relates to a tax exempt series related around the construction of the Hornsby Bend and Dell Valley clinics. And then the the last item here would be a certificates of obligation issue that would be a taxable series related to both the acquisition and the construction and renovation of both the facility, the former Sears building at Hancock Center. And then just as a reminder, the acquisition also includes the community clinic that's located at Hancock Center. So the total debt issuance is $77.7 million. And we anticipate coming back to both the Central Health Board of Managers and the Travis County Commissioners Court to approve those bonds at a future date. So that concludes, next slide, that concludes our presentation. We'll be more than happy to answer any questions that, that the board may have. Thank you.
Thank you very much. I really appreciate that. As you know, I have been seeking increasing detail on our capital projects. I really appreciate this. The 6-year look, looking at a kind of 6-year capital improvements program, knowing that the out years are a little squishy. And I certainly appreciate seeing the sources of funding. And I know we've discussed in the future, it would be good if we could see for each project, those specific project, those sources and uses, and that cash flow over time. Because as you pointed out, the cash flow is critical. We're not going to go take cash out of our reserves or issue you know, additional debt when from a cash flow standpoint, we won't need it for several years because we're not earning interest or because we're paying debt service, principal and interest that we wouldn't need to. But it would be good if we could see that more detail on the individual project basis when you're able to do that. And I appreciate you emphasizing that we have the ability to pay for these projects in the Eastern Crescent, and that we will be proceeding with them as quickly as possible. In some cases with the debt through the certificates of obligation, and in other instances through cash or through a combination of the two. And I think that that is good financial planning to use some debt financing and some of our cash that we have. Lastly, it has been well documented, and we're hearing about it in the media daily, the issue we have as far as demand and supply, or supply and demand in the construction industry, not just here, but nationwide. Demand has been increasing exponentially in the construction industry, and the supply of both raw materials and the supply chain issues and the price of raw materials, for instance, lumber, and the supply of labor, we know has been increasing. So we understand that there could be, you know, some changes in those estimates that were made several years ago. Thank you both for that excellent presentation. Do I see any questions or comments? Manager Valadez?
Hey, Jeff, thank you. I'm going to start backwards. So what facilities are we maintaining for the city and the county? I thought I heard you say that. I may be mistaken. So, you know, you're such a soft speaker. You know, I sometimes understand or get it right. So I just make sure I understood correctly. Did you say that we are also maintaining facilities for the city and the county? And if so, which buildings are they?
Okay, let me be clear about it.
Okay.
Well, when Central Health was created, there were some clinics that were conveyed over. And so we're not maintaining them for the city and the county. We're maintaining them for our use for those facilities. And I can get you a list of those facilities if you like.
Are there any facilities other than community care clinics?
No.
That we are maintaining?
No, they're community care clinics, community care clinics only.
Thank you. Managers, anything else at this time?
That's not my total question.
Oh, sorry,
Yeah,
sorry.
That's not my. Okay, so also, if you can put up the sheet that shows that we're going to be using certificates of obligation for Hornsby Bend and Dell Valle, but for Colony Park, we're going to be using cash. Can you put that up there, please? Can you hear me?
Yes, yeah, we're working on it. Hang on.
Okay.
Yes,
Is
I
this the
see.
slide you were looking for?
Yes.
Thank you. So are we going to spend, this is going to be 16 million or whatever, it's now the 14,535,000 in cash from our reserves for Colony Park? And if so, is that including, did I understand someone to say earlier, and I don't know if it was Mike or if it was somebody else, that said we're also going to be purchasing an additional tract of for all public health, and a library? Did I hear that? Are there 2 tracts of land we're buying in the Colony Park area?
So let me address the chart first.
If somebody could tell me yes or no.
Stephanie, do you want to address the purchase question first? That might be simpler.
There's 1 tract of land.
Thank you. Okay, Jeff, you want to?
Right, yeah. So on this line, yes, and that's what we have projected. 1 tract of land. The purchase has not occurred, but we're anticipating that the land purchase will occur in the middle column. It says project estimate through 9/30. So we're projecting through 9/30 that we have purchased and paid for the land, and that's the majority of the expense. And then the remaining, the $14.5 million is, you know, to a large degree, construction expenses related to the construction of the clinic.
Okay, so are we constructing a clinic, and we're going to be, what's this thing about the library and the APH? What is that? Why are we mentioning them?
Mike Giesland, do you want to respond to that?
Yes, I'll start out at a high level, and then Jeff, you can, or Stephanie as well, you can fill in some more details. But
level enough to understand it.
So what we're doing, once the land transaction takes place, then we can start having more earnest conversations with the city about co-location. And this is something that comes up frequently at the county commissioners court, as you'll recall. But in essence, you would have a place there where you have library, Austin Public Health, and potentially other city services. But the key to this is that, you know, while we can obviously invest in our health and wellness centers, if there is shared space, then we have to get paid back for that space that we construct. And so ultimately those cost sharing agreements, not only on the construction side, but also on the operational side, once you get going, still need to be worked out. And we're not even to the point of exchanging drafts or anything like that. I've had some high level conversations with Roosevelt Weeks, Library Services, and formerly Director Hayden Howard at Austin Public Health, now Assistant City Manager. And I know Stephanie and her team have had a lot more extensive conversations with those elements from the city. They have some of those conversations, but that's it at a high level. I'll ask others to provide more detail.
Yeah, I'll let me respond a little bit more to that. And thank you for your question. So the way that we looked at Colony Park is we don't really know what the structure, who's going to be in the building. We brought the budget forward. The Board of Managers approved the budget for all 3 clinics, and the budget was for just the clinical service portion of the building. And so, as Mr. Giesling alluded to, if there are other entities co-located in the facility, and there's been a lot of discussion about that, we'll have to work out the financing and the funding of that. But for budgetary purposes at this point, we're only looking at the clinical portion of the building, and that's what we've budgeted for. So until we have additional information, we will leave it at that, because it's what we know today, and we have a good estimate.
I appreciate that. But what I would like to say to my fellow board members is that if we have extra money and we are considering doing something like this, why don't we work with an imaging company or someone that can help us transition our Eastern Crescent, Hornsby Band and Dell Valley clinics to maybe upgrade us a little bit as we move towards the possibility of flexibility of adding some additional services to the Eastern Crescent where there is no infrastructure. I'd rather put our extra money there in working with a partner to co-locate in that area than in the city where the city can pay for its own help. Thank you.
Yeah, well, if I could respond to that. If I could respond to that real quick, just to be clear, we don't have extra money just around.
Oh, I know we don't.
And if there are, if we are looking at a co-location option, those entities will have to pay for the cost to co-locate. So we're not considering, we are, to be perfectly clear, we're not considering paying for the co-location costs for other entities, non-clinical, non-medical entities to occupy the building.
Yes, thank you.
We can't do that.
No, we cannot. So to conclude this, I'm just going to see if we can bring some clarity here. And that is, we are buying one piece of land. It is for us. We are not buying land for other entities, and we are not funding operations for other entities. If there is someone who chooses to co-locate, they will have to pay for that. So there is not funding that we are using for that. They would be paying us. All right.
I appreciate that, Sherry, and I really, really do. And I thank you, Jeff and Sherry, for explaining that better to me. But my priority is still provision of medical services to our needed Eastern Crescent. Okay.
Of course.
Thank you.
Of course, that is our top priority. Absolutely. Anything else on this item? If not, we will move to item number 6. Okay. Not seeing anything else, we will move to item number 6, receive and discuss a presentation on the Central Health historically underutilized business, open paren, hub, close paren, expenditures for October 2020 to March 2021. Lisa Owens, thank you again. You are back on deck. I will turn it over to you.
Last one. And I actually am not going to go into a lot of detail. We were here in February with our annual update, and the board has asked for more frequent reporting on our expenditures as far as eligible expenditures for hub participation and hub participation. So I really, this was in your packet. I hope you had a chance to look at it, but I really am going to hit the highlights, which is that we continue to have right around that 20%, which is what we had last fiscal year. And, I think it's very interesting. It looks like we are on track to have a very similar year. So we have not started any new major construction projects. You're really going to see this dollar amount go up when we have 2 ongoing construction projects next year. But, we are halfway through the fiscal year here, and we are at half of the eligible expenses. Our percentages are also very steady. And then we continue to have strong participation from vendors based on what they report on their hub certification. So I feel like what I can say is, although I can't tell the future, we're on track to have a similar year with the demolition ongoing and wrapping up, some of the campus activities. And then what we will most likely see in the next couple of years is even more exciting opportunities for participation, because in addition to really doing some targeted outreach for these upcoming construction contracts that I talked about for Dell Valley, and Hornsby Bend, and then getting into the larger projects that we also talked about that have not started yet. We will be doing targeted construction outreach with that to very specific sets of vendors so they know how to get information and participate in those solicitations. And then finally, just a reminder, the disparity study is ongoing. We continue to make progress with our vendor who's doing the work on that. It is an independent third-party analysis of our spending over the past, I believe we gave them 7 years. And you should be getting some information towards the end of the calendar year about when we would see the results of that. And then Colette Holt and Associates will come back to the board and give an update on recommendations and findings. So with that, I'm happy to answer any questions.
Thank you, Lisa, to you and your staff for your ongoing work on the disparity study. And I do look forward to the next few years where I think that we will, with these construction projects, that's typically where you have more opportunities for participation. You know, when we look at some of the larger entities, they have much larger capital improvement programs and ongoing capital projects that allow for more participation and higher dollar. But I think we will have over the next few years some additional opportunities with those construction projects. Thank you for your presentation and your hard work and that of your staff. Yes, Manager Valadez.
Thank you. Thank you very much. I'm going to continue to ask, you know, when we get these little pie chart graphs, is it possible for us to do, you have women owned at 7, or African Americans 0.1, Hispanic, which is Hispanic, 81.6 for all intents and purposes, and Asian American at 1.17. But it doesn't give us the context between male and female. And that is something that we really have as a Latina or as a Black or an Asian or Indigenous female. I see the number in that form, get a real who we're contracting with and who we're not contracting with. So if all of these are Anglo women, that does nothing for me as a Latina or a Black woman or an Asian woman or an Indigenous woman.
Lisa, do we have the data in such a way that that can be broken out? It would be helpful. I absolutely concur, Manager Valdez, to see it in that way. Do we have the data that we can break out?
I think we can give a little bit more information on that.
Okay.
It is self-reported, but I hear what you're asking, and
Yeah.
yes, I can work on that for the next round. That would be
Thank you.
no problem.
Thank you very much. Appreciate it. That would be helpful. All
That's
right,
a goal. That's a goal.
Manager Jones.
Question, did I see that figure right as 0.01 for African American?
I'm having a hard.
Reflect. That was what was that? What does that tell us?
Lisa?
I'm having a hard time hearing, but I think you asked about the low percentage of African American vendors.
Well, basically the no percent.
Is that what you were asking?
Yes. He's asking about that 0.01 number. Yes.
Yes. That reflects the dollars that we have identified as vendors who've identified their hub status as African American.
Are we trying to address the issue?
Yes, in fact, I gave an update and I'm happy to visit with you about the outreach work that we're doing. And we've given a couple updates, but last month I did give you very detailed updates on the outreach work that we're doing. And so we are working, you know, not only in the procurement department, but also with the community engagement team and our community partners to continue to do extensive outreach.
Let me
Yes,
suggest,
we are working.
Manager Jones, let me suggest, because there was a significant presentation, and I know that you've had other duties over the past few months, that if you would like, you know, a presentation on that to get with Perla, if that meets with your approval. Mike, did you have something?
I'll defer to Manager Jones first, but I had a follow-up to Lisa's comment.
Manager Jones?
I'm just saying yes. Thanks very much. I would appreciate that very much.
Okay, so let's
Yes.
organize
And
that.
the other, yes, we'll do. And the other important piece of information, board members to consider, is that this is the reason why we are doing the disparity study, because you'll recall, without that disparity study, it is very difficult to set very deliberate goals and pathways that if you're ever sued in a procurement, you've got a defense that you can make. And that's absolutely critical to this. And one of the driving reasons why we do this is so we can be a lot more deliberate in a safe harbor in terms of how we do business within the communities. So I think that's an important point to keep in mind and not lose sight of the reason why we're doing the disparity study in addition to the other project work that Lisa, Belina, and the folks on the community outreach team are doing. Thank you.
Yes, exactly. That's why we are so excited to see the hard work in progress on this disparity study and look forward to seeing it at the end of the year. Managers, Manager Jones, did you have something else?
Do we have a time?
What?
Do we have a timeline on?
We can't hear you.
It's hard to hear you, Manager Jones.
I think he asked if we had a timeline. Yes, we do.
Yes,
Lisa?
we have a timeline. Yes, Lisa, on the disparity study, yes. Lisa, what's the timeline for completion?
So the timeline for the completion of the disparity study is the end of the calendar year. It's a 1-year project, and we kicked it off December of last year. So they will be back to present the results
Thank you.
Towards the end of the year.
Yes, exactly. All right, members, we will now, yes, Manager Valdez.
If you can just add me a little class, Shannon and I. Thank you.
I'm sorry, I couldn't, you were breaking up. What were you asking?
I'm asking if I can be added to Shannon's class of Fedla being the teacher. Thank you.
Yes, understood. Okay. Perla will reach out to you also. Thank you. Sorry, there was some breaking up. All right, members, we are now moving to item number 7, receive an update and take appropriate action on a presentation from Sendero Health Plans, Inc. regarding 2022 CHAP enrollment, 2021 budget amendment and cash flow, possible agreement for reinsurance and potential creation of a new subsidiary and associated license application. And also we have agenda item number 8, discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new developments in Eastern Travis County. Members, we will be taking up these agenda items 7 and 8 in closed session. Agenda item 7, under Texas Government Code section 551.085, governing body of certain providers of healthcare services, and section 551.071, consultation with attorney. David Duncan, did I miss anything there? Okay, so members, let's take a 5-minute break. And I mean 5 minutes. It's 8:13. That gives you till 8:18 or less to do what you need to do and join me. Leave this meeting and join in the closed session link that you were sent. Okay. Okay, we are back in open session. We were in closed session on agenda items number 7 and number 8. Agenda item number 7, receive an update and take appropriate action on a presentation from Sendero Health Plans, Inc. regarding 2022 CHAP enrollment, 2021 budget amendment and cash flow, possible agreement for reinsurance, and potential creation of a new subsidiary and associated license application. Do we have a motion?
I have a parliamentary inquiry, and then I can see if I can make the motion.
Okay.
David, if I make the motion, can I still abstain?
Yes.
Okay. Madam Chair, I have a motion.
Yep. Okay.
I move that the board approve the resolution provided to the Board of Managers regarding Sendero from our council via email.
Okay, is there a second? We have a motion, a second from Manager Valadez. Is that what I'm seeing? Okay. All right, we have a motion and a second. Is there any discussion? Seeing none? Okay, all those in favor of the motion vote aye. Aye.
Aye.
Opposed, same sign. Okay, and abstaining? Manager Bell abstaining. Thank you very much, members.
Chair Greenberg, if I would, just another parliamentary point since Dr. Bell's got on that. I just want to let any members of the public that are watching know that the resolution itself will be placed in the backup for this meeting. It's not some secret resolution. It's just, it makes it easier for the board to vote on a resolution if it's just, we all agree this is the document we're voting on. So I'll make sure that Mike McKinnon gets that in the record.
Thank you. Thank you. Absolutely. It's just to make it more efficient for everyone as far as reading resolutions. So yes, David, please do ensure that that resolution is in the backup because we want everyone to have access to that. Okay, agenda item number 8 is discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new developments in Eastern Travis County. Members, there's no action necessary on this item, so I will
Chair
move.
Greenberg, if you would you mind reading the reason we were in the bullet? That's the reason. My attorney Hasib says you may not have read both halves of that. Could you just read that one more time and say we were in closed session on that
I
second
did read
bullet?
it. I read it.
Okay. All right. I'm sorry.
I did. Before we went into closed session? Yes, I did.
Carry on.
Yes, thank you. Number 9, confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is scheduled for Wednesday, June 30, 2021 at 5 p.m. or immediately following the Executive Committee meeting at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. But you know what, Manager, as David, you're making me nervous now, so I'm going to go back and confirm on agenda item number 8 that we were in a closed session on agenda item number 8 under Texas Government Code section 55.01071, consultation with attorney, and section 55.0172, deliberation regarding real property. So we're now back on agenda item number 9. Do I have a motion on agenda item number 9, which was our next Central Health Board of Managers meeting is scheduled for Wednesday, June 30, 2021 at 5 p.m. or immediately following the Executive Committee meeting at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. I'm ready to accept a motion at this time.
Motion to adjourn.
Second.
Okay, there's a motion to adjourn by Manager Bell, a second by Manager Valadez. All in favor, aye.
Aye.
Opposed, same sign. Any abstaining? No abstaining. Thank you, managers. We are adjourned.
Thank you, members.
Thank you.
Thank you, staff.
Good night.
Thank you, everyone.